Good morning to all of the explorers of knowledge and wisdom gathered today under the roof of this beautiful hall. I, Dr. Vismit Joshipura, welcome you all on this august occasion of book launch of the Big 5 Lessons from a Surgeon's Life, penned by Dr. Sanjiv Haribhakti. The sacred tradition of this part of the world is that everything is started, conducted, and concluded, devoted to the Almighty. We lay open today's program maintaining that same tradition with Ganesh Vandana, bowing down to the God of wisdom.
वक्रतुण्ड महाकाय सूर्यकोटि समाप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा
वक्रतुण्ड महाकाय सूर्यकोटि समाप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा
वक्रतुण्ड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा
वक्रतुण्ड महाकाय सूर्यकोटि समाप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा
This program is also getting webcasted right now, and so there are many people who have joined us online. I welcome you all of who has joined online also. Who is a Rishi? Who is a Rishi? To me, Rishi is a person who has reached salvation exploring any expanse of knowledge. They take any path of the knowledge, they go on refining, and then they reach the salvation. That person is a Rishi. And so far we have just seen the imaginary pictures of Rishis with beards and all. But today we are here to see, listen, and meet even Rishis of gastroenterology, namely Dr. Samiran Nundy, Dr. Vinay Kapoor, Dr. Nageshwar Reddy, Dr. Adarsh Chaudhary, Dr. Palani Velu, Dr. Parveen Bhatia. These are the persons who are intellectual heirs of the great teachers of Nalanda, Takshashila, Vikramshila, Valbhi, etc., ancient universities. I welcome all of the distinguished guests. So we start with our program with a video presentation by Dr. Nageshwar Reddy. Dr. Reddy is at present not available with us as he is occupied in his international travel to another conference, but he has sent us his video talk. Dr. D. Nageshwar Reddy graduated from the Kurnool Medical College, did his MD in internal medicine from Madras Medical College, and DM in the gastroenterology from PGI Chandigarh. He is the chairman of world's biggest gastroenterology hospital, Asian Institute of Gastroenterology. Dr. Sanjiv Haribhakti distinctly remember that when Dr. Nageshwar Reddy came to Ahmedabad in the year of 2008 for a conference, they were taking a breakfast in the morning, and on the breakfast table, Dr. Haribhakti expressed his wish to erect a hospital keeping the AIG as an idol, as the role model. And Dr. Reddy asked the budget first, instead of asking the other science related questions or technology related questions or academic questions. He first asked the budget. So Dr. Haribhakti was a bit awed to listen a word of finance from a devout scientist, and he replied, an X amount is, we have thought of an X amount of budget. Dr. Reddy humbly suggested to keep the budget of Y amount, which was almost 2.5 times more than what Dr. Haribhakti had assumed. Dr. Haribhakti was not so much convinced at that time with the amount proposed by Dr. Reddy. But after a couple of years, when the Kaizen hospital got finished, the project cost turned out to be exactly the same which was suggested by the visionary Dr. Nageshwar Reddy. So this was the memory he shared with us. I request Dr. Nageshwar Reddy to present his video lecture to us. Please run the lecture.
First of all, I'd like to congratulate Sanjiv Haribhakti for this venture. In fact, his book is remarkable in the sense that it doesn't deal with normal science of gastroenterology or gastrointestinal surgery, but beyond that, what we normally face as human beings in this field. I've gone through this book thoroughly, and I think it adds a lot to anyone's reading. I would have liked to be there. Unfortunately, I'm in an international conference in Dubai and cannot be there physically, and therefore this message in a virtual fashion. Sanjiv also asked me to talk on 5 big lessons in my life. Again, I'll sort of be brief on that, and I call them the 5 mantras. The 5 mantras in success are: don't miss opportunities, enjoy your life, socialize in work and free time, family and friends are important, and physical activity is important. Now let me try and expand a little on this. I am sure that many of you would have read this book on Ikigai, a very famous Japanese book on Japanese secret to long and happy life. Basically, Ikigai says that there are 2 things which are very important in life: happiness and success. Now, how do you achieve this? Again, this is something which I would recommend everybody to see on your TED Talks. This is a very famous study from Harvard. This study was started in 1938 by the Harvard School of Psychiatry, and the final talk is being given by Robert Waldinger. This was a study which was carried on for 80 years, where they took freshmen from Harvard Business School, very famous people who became, I think, famous CEOs or even presidents of America and so on. They started by asking them what was it that makes them very happy in life, and they all started saying it was power or money or fame and so on. At the end of 70 or 80 years, when many of them were about to die, they were asked the same question again, and the answer they got was surprisingly different. Most of them said it was not power, it was not money, it was not fame, but it was a social networking, a happy life, which was ultimately what they found was the happiest. That is, people who had networked socially well, who had many friends, were happy with the family, were happy, and there was no relationship with what money they made, what fame they got, or what power they had. So ultimately, happiness was not the success you achieve in money, fame, or power, but in success you achieve in terms of your relationship with your friends, family, and so on. And this was a very interesting study. Let me come to this concept of blue zones. There are 5 zones in the world designated as blue zones. Now, these are zones where higher than usual number of people live much longer than average. Now, in these zones, most of the people live above the age of 90 years, and the largest number of centenarians are in these zones. It's Loma Linda in USA, Costa Rica, Sardinia in Italy, Icaria in Greece, and Okinawa in Japan. When it was identified that people in these areas are not only living long but living very happy, the National Geographic sent its main one of its workers to go to each of these areas to see why this is happening. The Blue Zones is the paper that came out of Dan Buettner, and he says the reason why these people live long, why these people live very happy, are because of so-called 9 things, the power of 9. First of all, they reverse disease by finding a stress relieving strategy, and usually it's like, it could be yoga, meditation, anything. They find in a purpose in life which adds years to your life, and everybody has a purpose. It's not just that living purposefully. Their food is predominantly vegetarian, very less meat. Many of them have wine every day. For them, family comes first, and 80% rule is followed. That is, they never eat full. All of them eat only half, so that they feel that once you eat full, then you have a tendency to reduce your lifespan. Most of them are mobile. Even at the age of 90 years, they're walking, going to the fields and working. They surround themselves with the right group of people, and some of it is because of right tribe, right religious, and so on. And they have this sense of belonging to a faith-based community. Many of them attended the religious spaces like churches or temples or whatever it is. So these 9 factors, it was responsible for all of them being extremely happy. It was then realized that if you can follow this, then you can make your life certainly very meaningful. What I would suggest at this point of time is that all of you should have within yourself so-called Me Too time. That is, each day, each of you should have at least 1 hour to yourself, so that you do whatever is convenient for you, at which point of time. For example, for some people it may be watching a movie, for some people it's exercising, so some people it's reading a novel, and so on. So it's important that everybody has their 1 hour of Me Too time, and this is something that's going to make a difference in terms of how we are going to enjoy the rest of your life. Now, the second aspect, from happiness we come to success. And again, success is not what you achieve in terms of power, fame, and so on. Success is being happy with what you are doing. And this is why in the study from Harvard, all those who are happy with what they were doing at that age, 80 years, were the ones who are very successful. Now, success is not an accident. It's a result of an attitude. If you think you can, you can. If you think you cannot, you cannot. You're right either way. But I think it's very important to have a positive attitude, think you can and you can do it. Most successful people have what this is called the PCP formula. One is positivity. They're very positive about things. Two, they compartmentalize their feelings into different compartments. For example, all of us as doctors have problems in the hospital, problem with the patient, problem in the house. There may be some other stresses because of family and so on. Now, it's very important that each of these is compartmentalized to different zones in your brain so that they don't interfere with each other. You then come back to your problem one by one. You solve one problem, go to the next compartment. This compartmentalization concept is very important. And third, of course, is physical activity. So this PCP formula is increasingly gaining attention now in those who are very positive people. The other important thing is the 10x rule that I suggest to you, that there are actually 4 kinds of people. There are some people who do nothing and they want to be successful, but I want to do anything about it. Nothing happens to them. The normal action takers, average life, average goals, average outcomes. These are the people who again do not achieve much. The retreaters who have failed once and are not going to try anyway. But it's these people who actually do everything that they take massive action takers, they're called. They dream big, struggle to achieve these goals. So what you should be is into this group of people who tend to achieve what they want. They dream big, they achieve big. And this is again a very important principle in life. Rajat Gupta was once in our hospital and I asked him how he achieved so much in life. Of course, unfortunately, later in the life he got into problems for some things that were not his liking. But anyway, what he said was very clear, that whenever he achieves a level of comfort zone, he raises the bar above. And you set a higher bar so that you keep achieving more and more. So never let your comfort zone settle down at a bar. Keep thinking of achieving more and more, and that's how you get more. I had an opportunity of a dinner once with another very famous figure, CEO of an IT company, and asked him, what was the reason for your success? And he told me very clearly the reason for his success. Actually, I told him, can you tell me in a sentence? And he said, I can tell you in a word. The word is team. If it's the team is the one which is responsible for your success. And again, as doctors, we don't realize this. Coming together is the beginning, keeping together is the progress, working together is success. In fact, as physicians, as doctors, we are not trained in this. Medical education typically produces practitioners working solo. However, modern management of patients and institution requires teams. Physician training is full of example of absence of team building, and this is unfortunately very true. So none of us are actually trained to become good at team building. And this is another interesting book which actually tells you what they don't teach you in medical school. The three skills that they don't teach you are communication, people management, and entrepreneurship. And these are the three skills that are very important when you're managing people, when you want to start enterprises, and when you want to communicate better with people. Because these are the three important words that are not used by doctors, that as a team, a part of the team is very important, to say thank you, to say I'm sorry, and to ask your team members constantly, what do you think? Is this the right method? Good leaders always do this, and that's how you become good. In fact, the leadership success depends upon varying from being very strict to soft, from dismissive to appreciative, to be disconnected sometimes with the people, to show empathy. So all these are very diametrically opposite characteristics that are important in leadership, that have to be exhibited at various points of time. Now, in a team, you'll get across three kinds of people: people who make things happen, people who watch things happen, and people who wonder what happened. And actually, real success comes to the doer, not the observer. I think all of you who have worked in teams would have observed these three kinds of people. And you also would realize that it's a real success that comes only to those who actually make things happen and not wonder why it happened. We often observe this in our team: the winner has a solution for every problem, the loser has a problem for every solution. That's why one of the most important 5 mantras for success I would suggest is surround yourself with positive people. Try and eliminate the negative people, because these are the ones that pull you down. It's the positive people who pull you up. And the other important thing is that everybody says work hard, but working hard is not so easy. What you should do is not work hard, but work smart. This is a book which was important book based on this, that how you can convert working hard into working smart. That is, you have to really enjoy your work, and when you enjoy your work, hard work becomes easy work. And this is again allocating your work in proper ways. How you do that instead of wasting your time on unnecessary things, you can really increase your work efficiency. All of us have two ways of thinking. We think fast and think slow. There are two systems. The thinking fast system has come based upon our need in the jungle, for example, to escape danger. We have to think fast and run. So this is where the system 1 creates excess cortisol, excess adrenaline, and produces a sudden emotion. So our anger, our laughter, all is secondary to thing. System 2 is when we think of long term, it's more driven by rational, and this is the one which makes us better in terms of planning for our future, planning for the success of the future, instead of actually basing our emotions on the sudden episodes that occur. So it's very important that you minimize your system 1 and maximize your system 2, so that the ultimate success is achieved by this. And so that's coming to this very important statement that recently Kapil Dev said when we lost the World Cup, and all the players were saying there's too much pressure, and that's the reason. He said, if you're an Indian team, it's not pressure, it's pleasure. So what we have to do is convert this pressure into pleasures, and only then we can do what we can do. And the important goal is to enjoy what you're doing. As doctors, we have the opportunity to come across so many interesting stories from our patient, and you should keep looking at these stories not as lesions, as ulcers, as cancers, but as interesting stories occurring in every patient's life. I think this is important. The other important thing is to take opportunities, grab opportunities when they come. This is what I'd call serendipity that occurs in everybody's life. Opportunities, we have to take these opportunities and build on this. Let me tell you an example of my own. I was practicing in a small place in Medinova, 2 rooms, 1 endoscopy room when we started. A chief minister in the neighboring state's wife had lap coli, had severe cholangitis because the stone slipped into CBD. They couldn't take it out. We were called. He sent in his private jet. We then went in and took out his CBD stone from his wife's very severe cholangitis, saved her, and then he told us, what do you want? Can you start a center here? I said, no. Can you help us in Hyderabad? And that's how we got this old AAG hospital, Somajiguda. Soon it got filled with patients. rush. The chief minister at that time once visited us and said, there's so much rush here, why don't you build a bigger place? And then we grabbed that opportunity and then we built the new AIG hospital. So this just shows that great things are not done by impulse, but a series of small things that come together. And what resulted was our new hospital, which came out of this opportunity that we grabbed. If we had not grabbed the first opportunity and taken that small piece of land and build a small hospital, and then subsequently taken this bigger land to build this present hospital, I think we would not have achieved. So it's very important that serendipity is something that comes in everybody's life. Opportunities is how you grab these opportunities that become very important. And you can see that as the new hospital came up, the surrounding also changed. Skyscrapers came, and this area now is part of a modern part of Hyderabad. And this again, just to tell you that we could achieve this just because we grabbed this, took the teams to work together, and the resultant was an endoscopy area which we believe is one of the best in the world. So everybody has luck, chance, opportunity. It's very important to react properly, reject them, do not grab them. Tomorrow if you have an opportunity to start something, don't say no, we won't start. In fact, I remember many years back, Sanjiv Haribhakti was starting this new hospital, which I was fortunate enough to inaugurate, maybe 20 years now. And they had this opportunity, they immediately reacted, they grabbed it, started, and now you can see the final result. I recommend you to read this very, very nice book called The Chancey World by a Russian author, where everything in life is a chance, and how you grab this chance that makes a difference. So the secrets to success finally are, when serendipity and luck or opportunity comes your way, grab them, don't leave them. Convert your hard work into smart work. And finally, it's very important to work with a team and communicate well with the team. These are the successes that are the so-called 5 lessons that I've learned to success and probably happiness in life also. Thank you very much for giving me this opportunity.
Many thanks to Dr. Reddy for presenting his views regarding the success, what he has thought all throughout his life, and we can have a glimpse how much voracious reader he is. I request Dr. Reddy to present his views regarding this book. Please run the video of the view about this book.
I congratulate Dr. Sanjiv Haribhakti for coming up with this book, Big 5 Learnings from 25 Years of Practice, that will have a positive impact on young doctors, particularly those inspired to become GI surgeons. I have known Sanjiv for over 2 decades and admire his commitment to the profession and to his patients. He has achieved excellence in surgical gastroenterology. He has worked very hard for this for several years. In this book, he has shed light on the challenges faced in professional life, how practice has changed over years, and how to grow and build private practice and make strong teams. This is very important because I think the present strength of our institutions are going to be strong teams, and his team leader like Sanjiv is very important. Also, what is the future of GI surgery? He has built on that so that young surgeons who want to become GI surgeons should actually read this book to know about all this. He has shared his experience in how different private practices and corporate hospitals, single specialties and multi-specialties and patient care, and how to handle patients. This is very important again because he has rich experience in various of these fields and he has experienced personally in these areas. He's also emphasized on the medico-legal issues, on academics and research and innovations in the field of GI surgery. Again, in private practice, unfortunately, not much emphasis is made on academics and research and innovations. And all this have been very well covered in this book. This book also throws light on how to overcome challenges based by the medical practitioners on personal life. Again, a lot of us, we practice adequately, but we also have problems in personal life. There is a particular focus on health and fitness, again very, very important because we like to emphasize here that physical fitness is a very important aspect for any health practitioner, especially those practicing in the fields of GI, surgery and so on, where fitness becomes a very important factor not only for the doctor but also for the patients whom he is treating. The socio-economic of practice and how to maintain work-life balance also is very well covered in this book. I am sure a lot of people will take inspiration from this book to build their careers improve our medical system and strengthen the healthcare system of our country. I wish all the best for the success of this book and for future endeavors. Thank you.
Thank you very much, Dr. Reddy, for your kind words. Dr. Samiran Nundy, we all know him very well. He is like a banyan tree to all of us. He is with us online right now. He has joined us online. And Dr. Samiran Nundy is trained at Cambridge University, Hammersmith Hospital, and Massachusetts General Hospital, Boston. And his greatest contribution to the fraternity is his key role in passing Human Organ Transplantation Act in 1994, and the sweet fruits of his efforts we are testing today. These people are very important for the fraternity. They are master surgeons, they are excellent teachers, they are excellent orators. Simultaneously, they have an additional skill to connect to the right people in the administration, connect to the right people in the polity, and that's why they change the direction of a nation's entire medical field. So these people have far more contributions than an average good surgeon. Currently, he chairs All India Institute of Medical Sciences, Rishikesh. Dr. Sanjiv Haribhakti jovially remembers his first encounter with Dr. Nundy. In 1992, Dr. Sanjiv joined as a senior registrar in the All India Institute of Medical Science Department of Surgical Gastroenterology, where Dr. Nundy was heading as a professor. On first day after the rounds, as Dr. Nundy came to know that this new kid from Gujarat has no research project on his hand, he assigned work of looking after Bhalla's rats. Now, what is this Bhalla's rats? So it was a very perplexing question for Dr. Sanjiv, that what is this Bhalla's rats, and I am told to take care of Dr. Bhalla's rats. So Dr. Bhalla was doing some research on rats in animal lab of AIIMS, and he passed out from the AIIMS, and now all the rats were not having anybody to keep them up. And so Dr. Haribhakti was given that assignment to look after those rats in the animal lab. Dr. Haribhakti kept them very well and presented his paper after that. So I would like to request Dr. Samiran Nundy sir to give his views regarding his big 5 lessons of a surgeon's life.
Is the video going to play?
We can run your video right now.
Yeah, please.
Okay. He has sent us his video presentation, and he would also be available online and is a live commentary also.
Sanjiv Haribhakti, who I'm proud to say worked with me for 2 years when I was at AIIMS Delhi, has asked me to say a few words about 5 lessons that I've learnt in my life. The first lesson I remember was told to me by my headmaster in my posh boarding school in Darjeeling, who was an Englishman called Mr. Goddard. He said that it was a very expensive school and the most expensive in India. And he said that you people who have been privileged in life should do eventually something for people who are less privileged than you. And I remember this all the time, and I spent many years in England and America, but I always thought that I should go back to India and help people who are less advantaged. And my wife even more so. And we came back to the All India Institute earning 900 rupees a month in work, staying in a very small E-type flat of 700 square feet. It was a great change, but it is a wonderful decision because it was an opportunity to help people who were disadvantaged and who were very grateful. The second thing he said was that you should never rest on your laurels, that whatever you've achieved, you should think about that you should achieve more. They should be a stepping stone for things in the future. And there's no point in winning a prize or being honored somewhere, but it is very important that you use that as a stepping stone to achieve more things. Then when I went to Cambridge, I did quite well in my undergraduate education, and my professor of medicine called Sir John Butterfield, who eventually became Lord Butterfield, when I was struggling in India, said that when my wife went there on a Spastic Society conference, he told her that tell him that whenever he wants to come back, if he doesn't like it there, we will send you 3 tickets and he can get a job in Cambridge. That is not a lesson I learnt, but it was a major support to me for the rest of my life. That I knew that I had always something to fall back on. The third lesson I learnt was, having worked in India for many, many years. In the beginning, I came back having a lot of experience of working on dogs and monkeys and rats, mainly in Cambridge and Harvard, but I did not do that much human operations, and I had to learn on the job. So in the beginning, I was sent people with massive upper GI bleeding who were bleeding from esophageal varices. I used to open the chest and I ligated the varices, and out of the first 11 patients, 7 died. And most people said that my colleagues were saying that, you know, this great person who's come from abroad is really a useless surgeon. He should have an L plate on his back and he really doesn't know how to do surgery. But I carried on, I persisted, and then in elective operations, I started doing linorenal shunts for the first time at the All India Institute in a kind of concerted way. And out of the first 49, there was no mortality. And then this helped me to go forwards and do other more complex operations, and eventually helped to establish gastrointestinal surgery at the All India Institute. So the third lesson I learned is that never worry about criticism. You should always rise up above criticism. The other thing I learned, the fourth thing, was that in portal hypertension, that in Western countries, shunt operations were dying because they were done mainly on people with alcoholic cirrhosis and they got encephalopathy. In India, most people were poor, they came from villages and they had no access to bleeding, and a shunt operation was a one-time procedure which would stop them bleeding. But surprisingly enough, that whereas in Western countries, the people with alcoholic cirrhosis had encephalopathy, none of them that I operated on out of 600 had encephalopathy at all. We've never explained this. So we've written all this up in the British Medical Journal, the Lancet, the British Journal of Surgery, and it has been reproduced all over the world now. That extrahepatic obstruction, you don't need any, a shunt operation is the ideal solution for a poor person. And finally, the fifth lesson I learned was be grateful to your mentors. And I'm very grateful to my mentors who first were Lord Butterfield in Cambridge, and then Dr. B.N. Tandon, who I think was one of the greatest gastroenterologists in India and who supported me all the time I was in the All India Institute. And finally, Dr. K.C. Mahajan, when I transferred to Gangaram Hospital, who helped me having a very interesting life. And he was the person who spearheaded academics and ethics in the hospital. And I think all these people I should never forget, and I'm very grateful. And these are the 5 lessons I've learned.
It was indeed a pleasure to hear directly from Dr. Samiran Nundy about his big 5 lessons, what he learned all throughout his insightful life. I would request to run the presentation about what are his views about this particular book. So please run the presentation of about the book.
I read Sanjeev's book from cover to cover, and I was really enthralled. It is the opinion and outpourings of a very successful gastrointestinal surgeon who talks about how he attained his present eminence. He talks about his school days, his medical college, his work, and how his training, his family, and his philosophy, and his deep interest in religion. And I think that if I had been younger, I think that all young people should be compulsory reading for all young surgeons who are going to be trained. And if I had been younger, it would have been a wonderful thing for me to have got hold of. Thank you very much.
Thank you very much, Dr. Nundy, sir. Dr. Samiran Nundy is online and live right now. So we can interact with him. If anybody of you wish to ask something about his journey or any of his lessons, so we can interact him with live. And Dr. Nundy, we all are here to listen from you some other points you wish to highlight regarding young surgeon's life, the changing scenario, ethics, which we would like to talk. The audience is ready to listen you, Dr. Nundy sir. If you wish to extend your other views regarding the present scenario, regarding what do you see in the future?
Sorry, do you want me to come? The sound isn't very good, but you want me to comment on the present scenario and what the future holds?
Yes, sir.
I think the present scenario is not good. The present scenario is that India has 80% of people go to the pay out of pocket for healthcare, which should not be correct. I think that healthcare should be completely free, and I'm in favor of universal healthcare. And I'm not in favor of this corporatization of hospitals. In America, for instance, you'll have that although the private sector is dominant, there's 70% of people go to private sector. In India, it's 80%, but the 70% go mainly to trust hospitals, which are not-for-profit hospitals. And all these great hospitals like the Mayo Clinic, Massachusetts General, Cleveland Clinic, they're all trust hospitals. We should try and do that and get rid of the corporate hospitals. The second thing, I think, in the future is that there's a great future for Indian GI surgery or medicine. Because, for instance, as you said, the Transplantation of Human Organs Act came in 1995. And now in liver transplants, India does about 1,600 to 2,000 liver transplants a year, which is higher than all countries in the world except for America, Japan, and Korea. And I think that China and Korea, not Japan, we're much higher than Japan. I think that if we can do very well in such a complex thing like liver transplant, we can do it in most other centers. So the two messages I think are that we should have more accessible, affordable healthcare, which is appropriate to our population. I forgot to say that one of the lessons I learned was you must have Indian solutions to Indian problems. There's no point in copying the West. It's good to read up New England Journal of Medicine, but you should think global but act local. So the first lesson is do what is appropriate, and the second lesson is we have a great future.
Thank you very much. Thank you very much. It was really very much inspiring. I have also, I'm also fortunate to have some passing some brief time with you in Sir Gangaram Hospital, and I distinctly remember that for any you ask questions to the residents, and the resident will give some standard bookish answer. So you have a particular phrase. Can you apply this to the patient from Darbhanga? I think this was your favorite phrase, I remember, in Sir Gangaram Hospital. If anybody wants to ask any question, it is open. Yes, please. Mic check. Dr. Haren Joshi, senior surgeon, is there. Yes, now he's asking the question.
I'm going to ask the question that when I was in the USA, we almost stopped doing shunt operation because of the liver failure, and then ultimately ended up doing a proximal renal shunts. As you described that in India, when you did the shunt, encephalopathy did not occur. What was the reason that encephalopathy did not occur to the patient in India when you did the shunt?
The question
I wish I could answer the question. It's a mystery. We got 18 lakhs from the DST to research on this, and we never found out. The problem is the first shunt operation that it's not because the liver was normal, because the first shunt that the Russian surgeon called Eck did on dogs, the dog died of encephalopathy. But in extrahepatic obstruction, probably these people have been there a long time, and the portal vein has been sort of taken over by collaterals. We never found this. And funnily enough, extrahepatic obstruction occurs mainly in poor people, and it doesn't occur in rich people. So in Gangaram, all the shunt operations we do are for people in the general ward. In All India Institute, in those days, we used to do between 70 and 90 operations per year. And now I think it's gone down. And non-cirrhotic portal fibrosis, which is another cause of portal hypertension, is practically disappeared. It's most strange, but I wish I could answer your question. It's a very important question, but we don't know why. But a lot of medicine is empirical. In the old days, we didn't know why aspirin cured headache. Now we don't know why people with extrahepatic obstruction after shunt operation don't get encephalopathy. It's a very interesting thing to research.
Thank you, sir.
Thank you, sir. So, Dr. Nundy will be available on the webcast, and now we move forward in our program. Dr. Palani Wali was supposed to join us, but somehow due to technical reasons, time zone problems, and his continuous traveling into some remote areas, he is not able to join us. So we move forward for the main objective. We are now at the midway of our program, and we move forward toward the primary objective of the program, that is the launching of the big 5 lessons from a surgeon's life by Dr. Sanjiv Haribhakti. We all know Dr. Sanjiv Haribhakti, but as a protocol, I would like to introduce him. He did his MBBS and MS from NHL Medical College, Ahmedabad, and MCH in GI surgery from the famed SGPGI, Lucknow. He's a well-known surgeon and a lovely teacher. He's a mentor to so many of young surgeons who came across during his life from 1996 onwards, and including me. I request Dr. Sanjiv Haribhakti to come on the dais and give us some brief introduction and tell us something about what made him to pen this book. Dr. Haribhakti.
Thank you, Smith. It's indeed a pleasure today for me, because we have some galaxy of wonderful faculties with us. I welcome all of them, Dr. Adarsh Chaudhary, Dr. Vinay Kapoor, Dr. Parveen Bhatia, who are with us physically, and Dr. Nundy, Dr. Nageshwar Reddy, and Dr. Palnivelu, who are there with us virtually. I also welcome all the delegates who have come. Some of them are my teachers, my friends, my mentors, my students. And I'm very happy that a lot of people have joined online to witness and see this program also. The first question that comes in the mind is, why this book? Why did I want to write this book? We all know that life of a surgeon is not an easy one. It is filled with lots of difficulties. Just like when we go on a African game park safari, it is difficult to spot those big 5 animals or mammals. Similarly, the life of a surgeon is such that he has to face several challenges in his life due to various uncertainties, pressures, decision making, because the decision making of a surgeon materially affects the life of a patient. That's why he is always on his toes at whatever time of the day, night. And this makes the life quite complex for a surgeon. That's why we constantly need to do some of the other balancing acts between our personal life, our family life, our professional life. And in the process, there may be some joys, but there are often some sorrows, there are often some failures. And it's important for us to pick up, learn those right lessons from our failures. And I wanted to go a step ahead and learn to share these kind of lessons with others, so that we can enrich ourselves, we can learn from each other, we can learn from mistakes of others. And that is one of the primary purpose of this book, especially for the young surgeons who are pursuing on this career path, who want to choose this path and would know what this path is all about. Dr. Nageshwar Reddy very rightly said that that fine balancing between success and happiness is also very important. A lot of people we see in our day-to-day life are successful, but they're not happy from within. And what is that fine balancing also is something that we need to learn from the masters, those who are with us today. The second question is, yes, if you wanted to write a book, you could have written and just published it online or wherever. Why this fanfare? Why this big launch function, the CME? Why do you call people? I think the reason is because I wanted to, really sensitize this issue, create an awareness among surgeons that there are several life lessons that we learn which we can share with others. I wanted that we could, even if it inspires even one or two surgeons to pen down their experiences, I think my job is done. I wanted to share this experience so that the flame of knowledge which was ignited by my teachers and which has helped us in our career will probably inspire somebody else, and that flame of knowledge can continue. As our friends, our mentors tell us, Jyot se Jyot jalaya karo. So with this, I went on this journey, and I'm very happy that today this book is seeing the light of the day. The another important purpose of writing the book is to have a gratitude for a lot of people who have contributed in my journey for what I am today. And this contribution cannot go unacknowledged. It has to be acknowledged. I would like to acknowledge the immense contribution of my wife Niba, my daughter Pranali, in giving me the strength and the support for pursuing all my dreams. I would like to dedicate this book to my parents, who have been very, very supportive, unconditional love and support for my childhood, my education, and then thereafter giving me so much of freedom. My teachers, some of them who are here, my school days, my 12 teachers, Professor Gemawat is here, my physics tuition teacher. So many teachers have helped me during the school days. College teachers, so fortunate to have wonderful college teachers. Then my foundation training teachers like Dr. Nundy, Dr. Kapoor, so many others who shaped our career. My friends who were very inspiring all throughout my school days and college days. I've got a lot of inspiration from my friends because I've shared in this book that I was a mediocre student, but then how at a particular time, how the influence of my friends, my teachers, all this made me into a doctor and a surgeon is mystery for me even today. Our team at Kaizen, who have been solidly with us all throughout in this journey, Dr. K.S. Patel, Dr. Atul Shah, and a lot of other people who are with us in thick and thin continuously. So we have had this, very fortunate to have this wonderful team, not just the medical team, but the administrative team, the IT team, who have worked very hard to make this function a success. I would particularly like to mention my administrative assistant, Ronnie, who has worked very hard for this book. She has seen all the proofs, she has done all the changes, coordinated with our publishers. I would particularly like to mention them, have gratitude for them, Zen Opus, Kiran Thakkar and their team. They have done a wonderful task because there were several iterations and repetitions and so many changes that went along in this book. Finally, for proofreading, I would like to thank Amitabh and Compier Vismith for this function. All the delegates who are present here, all the friends who are present online on the webcast, I would like to thank them, because without this, there is no, that's the purpose of the book. And finally, without thanking the Almighty, with whose divine grace everything is possible, there is no way we could have done this. So with this, I thank you all for coming here and sharing this joy with me. It's a very joyous moment because this is the first book that I have written on completely my own. I have written a few books earlier related to our profession, surgical gastroenterology, laparoscopic colorectal surgery, but these are all multi-authored contributions from some of the stalwarts in the field in our country and abroad. And that is a different ball game. Write completely on our own is a completely different ball game. It's a very short book, so that one can read it in 3 or 4 hours. It's a short, it comes out with messages, clear messages also at the end of every session. I'm sure you will enjoy reading this and feel the, because we all go through these same experiences with our patients, as we grow in our career. So with this, I thank you all, and I would invite all the faculties on the stage for the book launch. Dr. Kapoor sir, Dr. Adarsh Chaudhary, Dr. Parveen Bhatia, I'll also like to invite Nibha, Dr. K.S. Patel and Dr. Atul Shah on the dais, please. Yeah, you can take it.
Yes. Please come on the stage, sir. Oh. We all are average Gujaratis, and we believe that we are now worshippers of Lakshmi, and we sometimes feel proud also. But I believe that we didn't start this journey with worshipping Lakshmi. We all are basically worshippers of Ma Saraswati, and so let's bow down to the goddess of knowledge, Ma Saraswati, in form of Saraswati Vandana. What is knowledge? If knowledge is an abstract noun, it cannot have a form. You cannot show that this is knowledge. But our great grandfathers had tried to go as much as near to a possible explanation how a knowledge can be. So the nearest possible explainable format of knowledge, I believe, is light. It's a flame. And that is why we commence our all works with lighting the lamp. I request the dignitaries to light the lamp.
या कुन्देन्दु तुषारहारधवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्करप्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा शुक्लां ब्रह्मविचारसारपरमाम् आद्यां जगद्व्यापिनीं वीणापुस्तकधारिणीम् अभयदाम् जाड्यान्धकारापहाम् हस्ते स्फाटिकमालिकां विदधतीं पद्मासने संस्थितां वन्दे तां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदाम्
Now the book is officially launched, and we are very happy that it has come to from the brain to the reality. And we wish that all the young and experienced surgeons both take inspiration from this nectar presented to them in the form of the big 5 lessons from a surgeon's life. Give a big round of applause to the book. I request Ms. Roni to present a small memorabilia to all the distinguished guests. Ms. Roni. Dr. Parveen Bhatia, sir. Please take your seat in the audience. Dr. Adarsh Chaudhary, sir. The cover page is so fascinating that many of us would like to have it, and obviously the contents are very nice. And so a little good news for all of you, that one copy, I would stress that complimentary copy for all of us is available, but after the lunch time we would all get a copy gifted by Dr. Sanjiv Haribhakti, and the book is now also available on the Amazon also. Now we move forward to our further feast of lectures, and our favorite orator is now ready, Dr. Adarsh Chaudhary. Dr. Adarsh Chaudhary did his MBBS from HP Medical College, erstwhile, now it is Indira Gandhi Medical College from Himachal Pradesh. He did his MS from PGI Chandigarh and FRCS from Edinburgh. Dr. Chaudhary is credited to start first department of surgical gastroenterology in this country. He is an extremely popular among surgeons for his extraordinary surgical skills as well as oratory skills. Dr. Sanjiv Haribhakti remembers him from the days in the AIIMS, New Delhi. Once Professor Chaudhary invited the young resident Sanjiv to his home for a dinner and gifted him an autobiography of Thomas Starzl. We all know that who the Thomas Starzl is, but those who don't know, he is the pioneer of the liver transplantation in the world. And his autobiography is named The Puzzled People. The young resident Sanjiv read that book again and again and got inspired by the book. He wrote a thanks letter to Dr. Adarsh Chaudhary in 1992, in the year 1992. So it was a letter from a resident, or many residents. He must have taught so many residents in his life, but he preserved that letter for another 3 decades. And sent his photograph to Sanjiv Haribhakti before few months. And you can see the letter in the book also. So these small things matters a lot. Why Dr. Adarsh Chaudhary is Adarsh Chaudhary? Because he knows that what is valuable. He keeps this small gesture of thanks for 3 decades. He preserved that letter for 3 decades and presented it to that person who later on became a renowned surgeon. Over to Dr. Adarsh Chaudhary, sir.
Thank you, Sanjeev. Thank you for inviting me. There are 2 ways of learning things in life. One is you learn yourself. Second is to get a guru. But interestingly, the guru comes to you only when you are ready. The ideal guru is the one who is real. Real means the guru should be reliable, he should be evolved, he should be accessible, and he should be learned. And I was very lucky that at a very young age I found my guru, because I never had the innate capacity to be wise, but I found a guru in me at a very young age, and I learned the lessons of my life very early. I grew up in Simla, and that's a beautiful city. It has a lot of British influence. The railway line was laid by the British, and when I was studying in Simla was possibly the only city in the country where every evening you had the choice of watching 3 English movies. So we could watch 3 English movies any day. So my college used to finish at 5, and I had the choice of watching 3 English movies. And fortunately, my parents were not control freaks. They let me do what I wanted to do. So I met my guru in Simla, and that's my guru, Hollywood. I watched movies left, right, and center, and contrary to what you people believe or made to believe, movies are not for entertainment. It's a fantastic movie produced in 1991 called The Grand Canyon, which is a movie about a story of relations, interactions, getting together, where this is the punchline. That's a part of the problem. You haven't seen all movies. Most of life's questions are answered in the movies. And that's what I have lived and I have felt, and I'm going to share with you. Interesting thing in life is we talk of resolutions which never work. Suppose you decided, I want to lose 10 kilos in 1 month. It's never going to work. It's never going to work because it has no point. If you decide that I am not going to eat dessert after dinner, that's going to work. So it's micro resolutions in life which work. You say, I want to be honest in life. Everybody says honest. It has no meaning. Honesty means next time when I go to a conference and there are pens lying there, I'll only pick up 1 pen. Doctors have a fixation for collecting caps, bags, pens, which never work. So that's how life moves. The first lesson I learned in my life was from this movie, Harry Potter and the Chamber of Secrets. This book was written in 1998. Movie came in 2002, and at that time, it was the 5th highest earning movie ever produced in Hollywood. My first lesson is that it's our choices that show what we truly are, not our abilities. If you think, Rohit Sharma has more strokes than Virat Kohli has. He's a more gifted player, but his choices are poor. He doesn't know what to execute one. So it's not your abilities, it's our choices. This is a patient of acute pancreatitis. The severe acute pancreatitis, you can see gas in the pancreas. This patient is very sick. You do a necrosectomy in the patient, you may be the world's greatest surgeon. You will push this patient to an organ system failure. So it's not your skills, it's your decisions that determine what you are. So the first message is that there are no answers in life, there are only choices. The mistake we make as human beings, as surgeons, is that we want to get an answer to every question in life. Some questions do not have answers, accept that. Mistake is you assume a wrong answer, and that spoils everything. The problem is not ignorance, it is the illusion of knowledge which destroys most of us. So the first knowledge is try to learn to make proper decisions, and your decisions are based on your capacity to think. The second message is based on one of the best movies I've ever seen in my life. It's called 12 Angry Men. How many people in the audience have seen this movie? Those who have not seen, God will not excuse you. You are guilty and you should be ashamed. This is a movie produced in 1957 by Sidney Lumet. It is one of the greatest understanding of human mind, conflict, controversy. It's a black and white movie shot in one room, 12 people discussing a problem, and what a brilliant sentence used by Henry Fonda, that whenever you run into it, prejudice always obscures the truth. And that's the biggest problem with us, because we have what is called as a confirmation bias. We seek, interpret, filter, research information that suits our beliefs. We do not want to listen to another point of view. Somebody who does laparoscopy only searches internet for information on laparoscopy, not for the other side. So confirmation bias is one of the biggest obstacles to medical personnel. I'll tell you a true story. A 67-year-old diabetic patient has coronary artery disease, has 2 stents, antiplatelet drugs. had passed some blood in stools, and proctoscopy showed grade 2 hemorrhoids. Next operation was a hemorrhoidectomy, because that's what we always do. In the post-op period, he bled again, and the operating surgeon said it is because of the antiplatelet drugs, because he's bleeding. Problem with life is that doubt is uncomfortable state, but certainty is ridiculous. When you're so sure of yourself, you'll end up into problems. Do you know, in the US, one of the leading cause of medical suits, some will agree, is for wrong management of rectal bleeding. Elderly patient who is bleeding in rectum, something else might be happening, but we never have a mind to it. So sigmoidoscopy was done. There was a growth found at 15 centimeters. Biopsy came as adenocarcinoma. CT scan showed no metastasis. The plan was a laparoscopic anterior resection by the operating surgeon. Since he had a bad heart, he was referred to a hospital. It's a big catch in this. We did a colonoscopy. There was a second tumor on the right side. That's how we make mistakes. The problem with us is we assume the obvious to be true. The most dangerous word in medicine is obvious. The obscure will eventually show it is the obvious which causes problems. Never believe the obvious. That's another mistake we make in life. So this is the second lesson of life, that many of us believe that we are thinking, but actually we are rearranging prejudices in our mind. The mark of an educated man is to entertain another man's opinion as also an opinion. But unfortunately, we are shut. We believe that my point of view is the only point of view which is correct. That's why we do not learn anything. The third lesson is one of my favorite movies. It's from a movie called Karate Kid. In this movie, Jaden Smith, who's a 12-year-old boy, comes to Beijing, where the school children beat him up, and he meets Mr. Han, who's Jackie Chan, who treats him for martial arts. It's not about treating about martial arts, it's training your mind. So Jackie Chan tells him, what a powerful sentence, your focus needs more focus. The biggest problem with most of us is we do not focus. Half of you sitting in this hall right now thinking something else. That's the tragedy of our life. We do not live in the power of now. We need to learn to focus. Look at this patient, underwent a laparoscopic cholecystectomy, had external biliary fistula, cholangiogram done, right duct seen, left duct seen, we don't know what's wrong. Everything is normal. But that's not true. What is happening is this patient has a right posterior sectoral duct which is separate. Because you do not focus. You really do not have a mind to put, you want to see what is there, you have lost the power of focus. In years to come, there'll be only two kinds of people in the world, those who can concentrate and those who cannot concentrate. You see people in meetings talking to you every 2 minutes, they check on their cell phone. What is it you are doing? You don't have a nuclear policy to decide. Some stupid messages you're trying to check which have no relevance. Because we do not learn to concentrate. This is such a powerful Zen saying that when drinking tea, just drink tea. Be where you are, and your focus will ultimately determine your reality. One of the biggest problems of surgical complications is there's a surgeon whose attention span is 45 minutes. You make him do a surgery for 3 hours, he's going to goof it up. So you need to understand what is my attention span, how much surgery I can do. So learning to focus, to my mind, is one of the biggest lessons of life, and I'm not saying that you focus all the time. You know to differentiate that here I want to focus, here I can take it easy. My boss in PGI, Dr. Kataria, who was the best surgeon in the world I've ever seen, I've traveled all over, a man with infinite skills. What did I learn from him? He knew where to go fast and where to go slow, because he had the power of concentration. Whenever he'll reach the Calloch triangle, his surgery used to become slow. So the power to focus is something you need to cultivate, and it's a kind of a meditation where you kind of collect all your senses together and put it into a strong power. My fourth lesson is from one of my most favorite movies. It's called 7 Years in Tibet. It's a true story of an Austrian climber who spent 7 years in Tibet with the young Dalai Lama in 1940s. Heinrich Harrier was a mountaineer from Austria. He came to climb the Everest. The Second World War broke. He was a German, so he was arrested. He was sent to Dehradun, where he escaped and went to Tibet. Dalai Lama was a young boy, and he spent time with Dalai Lama. And look at this powerful statement with one of Dalai Lama's minister tells Heinrich Harrier that the biggest difference between our civilization and your civilization is we emphasize get rid of your ego. One of the biggest obstacles with surgeons and physicians is our ego. Our ego does not let us believe anything. And three common cognitive biases which we have: illusion of control, that my anastomosis never leaks. If I say it is appendicitis, it's appendicitis. Because we have an unrealistic perception that I control events. I am God. There are three kinds of surgeons. One is CMG. Second is KCMG. Third is GMG. CMG is call me God. KCMG is kindly call me God. GMG is God calls me God. Please don't get into the GMG complex. So long as you're CMG, it's all right. Then we have an illusion of explanatory depth. We believe we know everything. I don't want to offend you. 95% of us do not know in an intestinal anastomosis what is the contribution of serosa, submucosal layer, and mucosa. An anastomosis we do day in and day out. I can bet 95% surgeons do not know what is the contribution of that. Because we have the illusion, we believe we understand things, and we are hardwired for optimism. We believe everything will go well. If I ask you all to close your eyes for 2 minutes and imagine where will you be after 2 years, 99% of us will think, I'll have a big car, I'll have a big house, my boss will get MI, I'll become the boss. None of us will think that I might develop a hernia. Some of us might develop Alzheimer's. Because our mind is hardwired for optimism, and that stems from the ego we cultivate. What is the problem when we have a complication we do not reoperate? You know the leading cause of why not resurgery is done is a phenomenon called WWPT. Means, what will people think? I have done this surgery, I re-explore, my reputation is go down, so your ego comes in way of making decisions. And I feel so amused when people do little surgery and talk big things. To my mind, that makes no sense. What a beautiful ad by Heineken beer, that if you make great beer, you don't have to make great fuss. If you do good work, it automatically will be recognized. Don't make noise. Small dogs bark more because they need to bark more and need to get attention. The last lesson I learned is from my favorite movie. It's a 1995 movie in which Marlon Brando is a retiring psychiatrist, and Johnny Depp believes he is the world's best lover based on the character of Don Juan created by Carlos Castaneda. And he goes to the psychiatrist, and Marlon Brando says this thing, that there are only 4 questions of value in life. What is sacred? What is the spirit made of? What is worth living for, and what is worth dying for? The answer to each one of them is love. Learn to love. Love your profession, love your colleagues, love what you do, love the people who work with you. Hate is too big a burden to carry. Love comes from inside. I tell you a story of a young boy who lived in a village, and he wanted to join an academy of chess, but that academy took selected people. So this boy knocked on the doors of that academy and said, I want to join this academy. So the guru said, you cannot join because we only take some selected people. This boy said, but I'm fantastic. The guru in his typical arrogance said, no, you cannot join. The little boy persisted. I have to join this academy, I'm the best. So the Guru said, okay, on one condition. We have a game of chess with my best player, and whosoever loses will cut off his head. Are you ready? He says, I'm ready. So they laid a game with the best chess player of the institute and this young boy. And the Guru was watching. And in 15 minutes, he realized the young boy is winning. When the young boy was winning, the Guru noticed he was purposely delaying the game. He was wasting time. And after 5 minutes, the Guru said, the game stops here. You don't only have competence, you have compassion also. You are good enough to become a student because only having skills have no relevance. Develop love, develop affection, have goodness to the world. If you ask me, when I have problems in my life, I have no interest in religion. I have no interest in God. But when I have a problem in my life, what do? I look at this picture of Shiva. 5 big lessons of life. Look at the way in the first position, the way he's sitting. Concentration and meditation, totally indifferent to surroundings. Lesson number 1. Learn to concentrate. Look at picture number 2. We all know Shiva swallowed the Sagar Manthan's poison. Negative feelings will come in you. It's impossible not to get negative feelings. Take in the negative feelings, don't swallow them, don't throw them out, just alter them. This is Shiva's lesson number 2. Shiva's lesson number 3, the snake around our neck is the ego. We all have ego. We all want to be identified. We all think we are great. But look at the neck. The head of this snake is pointing downwards. Use your ego to develop yourself. Go inwards. Those who go inwards succeed. And look at the 4th lesson. Look at the Trishul in his hand. The 3 folks tell us that decisions should be based, bereft of ego, mind and intellect together. Put your decisions. And the last is dust on the entire body of Shiva, which tells us everything is dust. Learn to love people, not things. Once you realize everything is perishable, when we die, nobody asks what car you drove, what watch you wore, how many whipples you do. People only ask one thing: what difference you made to people's lives. And Sanjiv, you've done that. You've written a book. It may be a small drop in the ocean, but you made a difference to people's lives by contributing at least one bit of wisdom which changes somebody's life. Your life is worthwhile. Thank you so much for inviting me here. What am I supposed to do now?
Would you like to say some words about the book after you're reading that book?
I can't say any words about the book. I can say a few sentences. I have only 2 things to say. First thing is that I'm faintly envious of you, Sanjiv, that you wrote the book. I've been thinking of writing a book for many years, but I could not write a book for various reasons, because one of the titles of my favorite book was The Women I Have Known. I couldn't have written it. The second title was The Women I Wish I Had Known. I couldn't write it. So I could not write any of the books, but you wrote a book which is fantastic. And second thing is, you wrote it very honestly. And third thing is that you have such humility which is not seen in surgeons. So you are bereft of humility. No wonder you've done well. So you give me credit for preserving that note for 30 years. When he came to my house, then only I spotted that he's going to be a big man one day. That's why I kept that thing, and see, it's become invaluable. Thank you.
Many, many thanks, sir. Sir, you yourself is a book. Many, many, many thanks to Dr. Adarsh Chaudhary. And I think everybody would have felt that let him speak for hours and hours and hours, and we go on listening. We move forward to another gem, and again one more very magnetic orator and very respectable professor, Dr. Vinay Kapoor. Dr. V.K. Kapoor did his MBBS and MS from prestigious All India Institute of Medical Sciences, New Delhi, and FRCS from UK. He headed the Department of GI Surgery at SGPGI Lucknow, and in his tenure, the department soared to the seventh sky, and his mentor to n number of GI surgeons of this country, including Dr. Sanjiv Haribhakti himself. Currently, he heads the Department of Gastrosurgery at Mahatma Gandhi Medical College, Jaipur. Dr. Sanjiv did his MCH under guidance of Dr. Vinay Kapoor. And obviously, there are hundreds of memorable incidents during that tenure. Dr. Haribhakti distinctly remembers his viva with Dr. Kapoor in the entrance exam for the MCH course. He presented the steps of linear shunt, and the in-depth knowledge of Dr. Haribhakti impressed Dr. Kapoor to that extent that he himself broke the news of getting admission in the MCH to Dr. Sanjiv Haribhakti on phone. This is the grace of a great teacher. Let's enjoy the pure extract of decades-long experience of Dr. Vinay Kapoor.
Good morning, everyone. I noticed that Sanjeev calls it a CME. Now, CME for us means continuing medical education. Dr. Chaudhary tried to teach us a little bit of medicine in between, but I think he taught us more about movies, Hollywood. One difference between me and Dr. Chaudhary is that I don't watch any Hollywood movies. Now I have started watching because subtitles are there. Earlier I never watched because I couldn't understand. I am a fan of 60s and 70s Bollywood. But this is not a continuing medical education. I think it is more a continuing moral education. But is the word continuing right? Are we taught morals in our schools and colleges? Maybe earlier, yes, but these days I don't think. And unfortunately, these days, parents also have very little time, even if they want to teach morals to the children, because children are busy, as Adarsh pointed out, with the gadgets. So I don't know whether it is appropriate to call it medical education or continuing medical education. Anyway, let me start. So intentionally I have put formerly at SGPGIMS Lucknow because that is what connects me to Sanjeev, because if I say that I am presently at Mahatma Gandhi Medical College Hospital in Jaipur, you would start wondering what is Sanjeev's connection with Jaipur. So that is where I am now after finishing my more than 3-decade term at SGPGI Lucknow. Now, what is Big Five? I think, as Sanjeev also pointed out, the term comes from the safaris in Africa. That is probably the origin of the term, the Big Five. So they are well defined. Everybody knows what Big Fives are in Serengeti. But is the term defined for life? Because that is the title, Big Five Lessons from My Life. So Big Five for Sanjeev may be something else, Big Five for me may be something else, Big Five for you may be something else. So that is why I will be talking on things which are slightly different from what Sanjeev has touched in his book. And since this is a very personal presentation, please forgive me if I get a bit emotional. So I think the journey for anyone starts at the school. After home, obviously, the journey starts at school, and I was very fortunate to study in this residential school, which was founded by Annie Besant. And then Jiddu Krishnamurthy took over as the philosophical head of the organization. It was called Krishnamurti Foundation of India, and by looking at these teachers, you can guess how simple they were. These are all the teachers of that school. That time I didn't even know or try to find out, but now I have found out they were paid very little salaries. Only perk they had was that they were given accommodation on the campus. The campus is situated on the junction or the Sangam of river Varuna and Ganga, and it is actually a spot of archaeological interest also, because a lot of remains of I think 200 BC or something have been found on the campus. So a huge amount of credit of whatever I have been able to achieve in my life goes to these teachers. I studied there for 3 years under a Government of India merit scholarship, because my parents obviously could not afford to send me to a residential school. And then, of course, the All India Institute of Medical Sciences, where I did my MBBS, MS, and senior residency, played a very important role. And I was very fortunate to be part of a unit. So these are all members of the unit where I worked, and the entire unit in a bus came all the way from Delhi to Meerut to attend my, that is me. So to attend my wedding. And they requested the residents and faculty from other unit to look after the patients that night. So the entire unit was theirs. And those of you who know, you can see Dr. Sadiq Sikora here. This is Dr. Sadiq Sikora. And this is Dr. MC Mishra. This is Dr. Kriplani. So they all were there. And Dr. L.K. Sharma, who was the chief of the unit. So it was more like a family, and that is what a unit should be. Unit is not only that you are there to manage the patients. The members of the unit, it is the responsibility of the head of the unit to take everybody as part of the family. And like Sanjiv, I could repay my debt to my unit chief. Then obviously a big move in my life at that time, it was a move because I had no choice. I was not selected as a faculty member in AIIMS, and here I got a job in an upcoming institution which nobody had heard the name of. Nobody knew what SGPGI is. Everybody knew that in Lucknow there is only King George Medical College. So even when we would say that we are working in Lucknow, everybody would think we are working in KGMC. So it was more because I had no choice. I was getting a job, regular job with a decent salary, that I moved to Lucknow. Another reason was that my wife's parents were in Lucknow, so she was not reluctant, she was not hesitant, she didn't oppose the move, and we moved to Lucknow. Historically, the Indira Gandhi Institute in Patna had come up earlier, and unfortunately it did not do well, it was not doing well. So at least I didn't think that I would be having a long or a good career in SGPGI. It was just because I was getting a job that I moved there. But then again, as I think Sanjiv also has mentioned in his book, that opportunities come, and if they come at the right time, they help in building your career. And Dr. Subhash Naik, who was the chief of gastroenterology, he was there already as a professor, and I had joined as a young assistant professor. But because there was no senior person in surgical gastroenterology, on paper I was the head of the department, and he was also head of the department, and he treated me at par. I had just become an assistant professor, he was already an established professor, a known name, and he became a mentor for me. And then Dr. Kaushik came, both of them are no more with us. And that gave a strong push to the department. Because I still remember, even before he had joined, he had already been selected, but he had not joined at that time. And I was meeting him for the first time. I had not met him earlier. He said, I have played my innings. You people continue to bat. I and my colleague, Dr. Rajan Saxena, who was his student from PGI Chandigarh, we were there. And I am there to support you, to push you, to protect you. And that is what was a big help in our careers. So that's the team. Dr. Rajan, me, and Dr. Kaushik. This was a party which he hosted at his house after he had retired in Chandigarh. SCPGI also was very kind of unique institution, not only in its structure, because it had no MBBS courses, which of course were not there in PGI Chandigarh also, but it had no MD or MS courses also. So that way it was different even from PGI Chandigarh. It was established only for super specialty training. I must say a very rare phenomenon that a government of a state like UP thought of an institute like that, a unique institution which will offer only super specialty courses, DM and MCH. And it was distinct from the already established institutions, and credit for that I think goes to the founding fathers, including Dr. B.B. Sethi, who was a psychiatrist from KGMC, who was the first director, that he had this vision that this institute has to be different. And again, it points out that when you create something, it has to be different from what is existing. Then only there is a possibility that your organization, your institution, or your venture, or whatever you are doing will probably grow and shine. So the rules and regulations were very liberal in terms of allowing faculty members to go and attend conferences, go on fellowships, scholarships, and other assignments abroad. And this is the only picture I have from my first international visit. This was a conference in Sweden, because I didn't even have a camera at that time. So this was a picture taken by somebody, and he had then sent a copy to me. That's the only picture I have of that conference. And I distinctly remember in this conference, Dr. Aranya, who was the chief of GI surgery at GB Pant when Dr. Adarsh was also there, he was also attending, but he was not sitting on this table because the seats were assigned by name. So this liberal policy of SCPGIMS in the initial years at least gave me an ample opportunity to establish links. And that is the importance. I don't know how many young people are attending this CME, but it's very important that you establish contacts, you maintain the contacts, you nurture the contacts, and that is how network is created. Many of these big stalwarts, I would just name them. This is Dr. Schwartz, the Schwartz textbook of surgery. And when I visited him, and then he agreed to write the foreword for my book. That's Prof. Bismuth, who's listening very attentively to what I am saying, disagreeing with him on some of his philosophy of management of bile duct injury. He wrote the foreword for my book on bile duct injury. That's Guma, Dr. Guma from Academic Medical Center, Amsterdam, one of the very famous GI centers. That's Prof. Cameron, John Cameron, who also has written a foreword for my book on operative surgery. These are two stalwarts of biliary surgery, Bismuth and Strasbourg. And that's Prof. Nimura from Nagoya University. So one contact led to another, and then to another, but you have to maintain. And one thing which I always did after coming back from a meeting, I would always email everyone whom I met, reminding him or her of our meeting, and then keep in contact with them. So that's very important. Also, it's very important to establish all the others which I have shown here are people who are much older, much senior to me, much more known than me. But it's also important to maintain contacts with people who are younger than you, and this is Dr. Han, a very skilled laparoscopic liver surgeon. Dr. Anil Agarwal from GB Pant Hospital has been a good friend of Dr. Han, and actually Dr. Anil introduced me to Dr. Han, and then our own friendship flourished, and we have met several times at meetings and conferences. And so it's very important to keep contacts with bright, younger people than you also. And as Dr. Adarsh and both Sanjiv also highlighted, that ego should not come. It should not. I should not feel that, oh no, he's much junior to me. Why should I establish contact, or why should I maintain a network with him? Another thing which I learned, it's not that people in the West are not good. It's not that they are bad, but I think it's their culture that they do not kind of become personal friends. Very unlikely. The relationship remains more professional, more formal. Whereas the Eastern culture, Japan, Korea, China, are more like us. When you meet somebody, even for a professional reason, later on you tend to become more personal friends. And therefore, I would suggest that we should also try to look east, and we should also try to look south, South America, Africa. These are nations where I found that India, and especially Indian professionals, medical professionals, are respected to a great extent, and one can establish very good relationships and contacts with these also. Traditionally, because of, I think, the colonial rule, we have always looked towards the West. We always look towards UK or US. But in addition to that, we should try to look at the rest of the globe also. It's very important, if you are at a young or at a middle age, to identify some niche areas. Now, I'm sure in every city there are shops like this which sell only one product, but in terms of name and I'm sure in terms of revenue and profits also, they make much more than people who do everything. So this is, I'm told, I don't know whether it is the same one or another one. There was a tea shop in Chandni Chowk, which during the emergency, when the encroachments were being removed, he paid fine every day of the emergency for the entire duration of emergency, but continued his shop because his business was so much. So you have to identify an area, and for some, again, fortuitous reason, I picked up an area which now we have realized is very common in North India, gallbladder cancer, and fortunately for us is not so common in the West, so West has not paid much attention to it. And all this happened when Prof. Blumgard visited AIIMS, I think way back in 84 or 85, and then I was a ad hoc faculty member for a period of 3 months, so there was a departmental meeting, and it was being discussed as to what should we present to Prof. Blumgard, because he was the doyen of biliary surgery even at that time, and we didn't have anything to show to him or to present to him. So very meekly and in a very low voice, I suggested, why don't we present something to him which he may not be seeing, and that is gallbladder cancer, because we were seeing a large number of patients. And then it was me and Dr. Arvind Kumar, who is now a very skilled robotic surgeon in Delhi. We were both ad hoc faculty members. So we were given the task of taking out the data of last 5 years. And Dr. Chattopadhyay, who recently retired, one of my other mentors at AIIMS, he presented, and that was also published. This experience was published, and I think either in the past or in future, that is the only publication from AIIMS which carries the names of the heads of the units of all 4 units. That is another problem in our institutions. When we create units, they become independent entities. There is hardly any interaction between units, between the faculty, residents, and even clinical material, research. So they become like 4 departments, whereas if they come together, the data, the experience, everything will be 4 times. And then when I moved from Delhi to Lucknow, in the first few days I realized that gallbladder cancer is probably even more common in Lucknow than in Delhi. And I remember Sandeep Avasthi, who's now a consultant GI surgeon in Lucknow, he was a senior resident. We hadn't started an MCH course at that time. I told Sandeep, please keep a data of all these patients. I think we will see a large number of patients even in 1 year. And from day one, he started keeping the prospective database of patients with gallbladder cancer. Every patient who would come to us, he will keep a record. And at some stage, Sanjiv also looked after the database of gallbladder cancer. And then over a period of 3 decades, it has accumulated into one of the largest single institution experiences with gallbladder cancer. And because of that, I could publish this monograph. Also, as I think Sanjiv also has mentioned, and a lot of people say, that in every adversity you should seek an opportunity. So unfortunately, gallstone disease is very common in North India. Cholecystectomies are being done at every level, tertiary, secondary, primary level. Even untrained people are doing cholecystectomy. I am told even people who are not surgeons are doing cholecystectomy. Now, recently, Ayurvedic doctors have started doing cholecystectomy. So, for whatever reason, a large number of bile duct injuries are created, I would say, not occurred, created. And because we were a referral center, a large number of bile duct injuries were referred to us in SGPGI. And unfortunately or fortunately, again, SGPGI has world's one of the single largest single institution experiences with management of bile duct injury. Whipples, we are not as skilled as Dr. Adarsh is, so our complication rates were higher, our mortality was higher, but that also gave us insight, that gave us experience, and even that we could convert into a publication. So even if your results are bad, you can make use of that at least to tell others why your results are bad and how others can improve upon it. Another thing which I always tell my residents now is that be ready. So for example, every young resident wants to go and present a paper at a conference abroad. But you have to be ready, you have to be prepared. So I tell them that at every point in time, keep 2 or 3 good abstracts ready. The moment an announcement comes, submit that abstract and you are likely to get accepted. So this was again way back in 95, I think, that I got a travel grant to present a paper at that time as a young faculty member at a conference in Japan. This is Dr. Nonami. Behind us is the small but beautiful, famous Nagoya Castle. Also, do not hesitate to ask. Many a time we are kind of shy, we don't want to ask. So this is, I remember that I somehow came to know that an Asia Pacific Association of Gastroenterology meeting is going to be held in Sri Lanka. So I knew that Sri Lanka, the disease spectrum is same as us. My another area of interest was abdominal tuberculosis, which again, I was fortunate that even as a resident, along with Dr. Sharma, I could publish a leading article and editorial in the prestigious British Journal of Surgery because the topic was abdominal tuberculosis. So people in England, they see patients of Asian origin who may have tuberculosis, but they don't know about tuberculosis because they are not taught about tuberculosis. So that was probably the reason why BJS accepted that editorial. And I also got £100 at that time, which Dr. Sharma was gracious enough to say that you keep the money. So I wrote to the organizers of the Sri Lanka conference that we have a fairly large experience and I have some publications on tuberculosis. Would you want me to present it? And they invited me, and that was my first international invited lecture presentation. If I hadn't asked them, I probably would not have got the opportunity. Very important to keep documents like Dr. Adarsh has kept, that today you may think that a movement, an event, a person, a document is of no consequence, but still keep it. And today it has become much easier. You just click a photograph and save it. So it is much easier to save documents today, to save memories today. At that time it was very difficult. So this is when I joined as a junior resident in surgery, This is a diary which one of the medical representatives gave to Dr. Atam Prakash, who was the chief of surgery at AIMS at that time, a very prominent figure. And I was sitting there, so he just took out his pen and signed it and gave it to me and said, Vinay, keep the logbook of all your cases. And I maintained that, and I still have that logbook with me, where I recorded each and every case in which I was scrubbed, who all were there with me as consultant or as co-residents. So it's very important to document, and now almost it has become a habit. Even now, in the era of modern technology, I still carry a piece of paper and pen. Anything which happens during the ward round, in the theater or anywhere, I always scribble notes. And every time in my bag, I am carrying notes which I now transcribe into computer text. Sometimes you are given some jobs by your seniors or by your administrators which you think are useless jobs. Like I was asked to produce this booklet first decade, again when I was a young or a middle level faculty member in SGPGI, and it was Dr. Nayak, I remember distinctly, who pushed me into this, and he said, nahi Vinay, ye tumhe karna hai. And I said, this is wastage of time. What is this going to be of help to me? इतना टाइम लगेगा, इतने सारे डॉक्यूमेंट्स कलेक्ट करने हैं, हर डिपार्टमेंट से मांगना है, मुझे मालूम है लोग देते नहीं हैं, सबके पीछे पड़ना है. एंड डॉक्टर नायक वाज अ परफेक्शनिस्ट. Unless the book is complete, unless everything is in order, he will not accept it. So you have to do that job. And I was very kind of resentful, although I did it. And Rakesh Agrawal, who was my younger colleague in gastroenterology, who's now the director of JIPMER Pondicherry, he was my assistant colleague in this. So two of us and one more faculty member. But I was primarily responsible. Now, when we finished the job, the publisher also did a good job. The get-up was very good. So then suddenly it struck me that in India, in UP, in Lucknow, nobody is going to read it. Who is interested in what SGPGI is doing? It is more as a formality that institute has produced it. Maybe people who have come to SGPGI as visitors may like to read it. So I took out a list of all examiners, all experts who came, all foreign visitors who came to SGPGI in various departments, and sent a copy to everyone. At institute's cost, of course, I didn't have to pay for it. Now, one copy I remember, the address, the name and address which was given to me was by Dr. Yacha, who was my pediatric gastroenterology colleague. He is now in Bangalore. And this was Professor Mowat from King's College Hospital. He was a pediatric gastroenterologist who had visited Dr. Yacha. I did not even meet him, but he gave me the name and address, so a copy went to Dr. Mowat. Now, he replied back, thanking me, that thank you for sending me a copy. And around the same time, I think a year after that, I thought of applying for a Commonwealth Fellowship. So that required a host acceptance. So I wrote to Professor Mowat that can you please help me to have a surgical host at King's College Hospital for my Commonwealth application. So he immediately said yes, and he introduced me and forwarded my CV to Dr. Benjamin, who was his surgical colleague. I had not met Dr. Benjamin by that time. And Dr. Benjamin said, yes, I will be your host, and that is how the story started, and I got the Commonwealth Fellowship. So nothing goes waste. If you use it properly, you can make use of everything. Like it is said of many plants, that every part of the plant which we think is a waste can be used if you think about it. And that's another, my second leading article in British Journal of Surgery with Prof. Benjamin. And again, it is about something which is not common in UK. So both the things worked. We wrote about, if I had written about Crohn's disease, BJS would have said, no, what do you know about Crohn's disease? But because we wrote about something which was more common in India and not so common in UK, but now they are seeing all these diseases because a lot of Indians, a lot of Asians are going there, so they got interested. Also, a lesson which I learned from my now a younger colleague, that time my student, Dr. Ibrarullah, who's now at Apollo Bhubaneswar. He was doing MCH with us. So we did this very small study of cholecystectomy with those of you who remember that when we used to do open cholecystectomy, every cholecystectomy we would leave a drain. In fact, in one case in AIMS, I remember either by we forgot or the drain came out when the patient was being shifted, and the whole unit got a dressing from Dr. Sharma and Dr. Chatterjee that how is it that there is no drain after a cholecystectomy. And today we know that we don't put drains. So we did this small study, and I was not very happy with it. It was a small experience, some retrospective cases and some prospective cases, not randomized. And I was thinking of submitting it to a middle level journal. And then Ibrar said, नहीं sir, भेजते हैं किसी अच्छे जर्नल में, ज़्यादा वापस आ जाएगा, क्या फ़र्क पड़ता है? So I said yes, and we sent it to World Journal of Surgery, and it got accepted. So always aim for the point which was set bar, but don't push the bar too high also, because if you are jumping 3 feet and then you put it at 6 feet, obviously you will fail. So if it is 3 feet, put it at 3.5 or 4, and if you succeed, it's a bonus. If you don't, you can always do 3 feet again. Now, what should be the priorities in life? I think for everyone, first 2 priorities are parents and teachers. That should go without saying. Even if I know that today as a teacher, I am a teacher today, but I cannot claim to be as dedicated teacher as my teachers there in Rajghat Basement School were. I mean, they were selfless. They had no expectations either from the administration or from our parents or from us. They were selfless. We are not. But still, I think parents and teachers should occupy the first 2 places in anybody's life. Now, those of us who are in medical profession, doctors, the third priority has to be patients. It again goes without saying. Whether you are in government institution, whether you are in a trust hospital, whether you are in a corporate hospital, whether you are charging, not charging, charging hefty amount of fee, that is a separate matter. That is your policy. But ultimately, the patient's interest has to be the priority. And then on top of that, if you are a teacher or a trainer, which now most of us are, even in corporate hospitals because of the DNB training program. Even if there is no DNB program, the younger faculty, the younger residents who are working with you, in a way you are training them, you are teaching them. So they become the next priority. And then for your own interest, I have put friends in between. Unfortunately, Nibha, for doctors, for surgeons, for teachers, the family comes low. That is not, I know that Sanjiv has regretted that in his book, but that regret all of us, if you ask us to write, we will have. Because in my opinion, family does come at the bottom of the list. Right or wrong, I don't know. It has happened, I think, with 99% of us who are in medical profession, at least in the formative years, till the middle level of career. As I said, right or wrong, but family definitely goes down on the priority list. Now, we are all fond of treating VIPs, but in my definition, VIP is very important patients. Very important. Even now, on my phone contact list, there are some patients who are listed as so-and-so hepaticojejunostomy, so-and-so hepatectomy, so-and-so pancreatic necrosis. These are some select patients who can call me any day, any time, even if they are 10, 20 years. Somehow a personal relationship developed. Now there is this young lady, those of you who are doctors and surgeons, from a very rural background. I think she was not even educated, or maybe up to class 4 or class 5. And she had a large dermoid cyst in the retropancreatic region. So we thought we'll take it out. We went in. But as we all know, dermoid sometimes can be very problematic. I think it is because of the sebaceous material which exudes out of the wall, which causes, Sanjiv, am I all right with the time? Causes intense desmoplastic reaction. And in fact, I remember once when I was a resident, Dr. Chatterjee was operating again on a young lady with a retrohepatic, infrahepatic dermoid, and as we were dissecting, there was a rent in the IVC. So again, probably there was a lot of desmoplastic. So this young lady, we could not excise it because the portal vein was there, the superior mesenteric vessels are there, celiac axis is there, and I and my other colleague, Dr. Anu Bihari, very close friend of Nibha, we were both, because I was running into problems, so I called her for help. And then we both decided, no, we can't risk the life of this patient, because if the portal vein opens, we will not be able to save her. She will die on the table because of bleeding. So we did as much excision as possible and left the remaining inside and put 2 drains, thinking that whatever is left, we will ask our interventional radiology colleague to destroy it by alcohol once everything gets localized. And she went on to have this drain secreting some sebaceous material for months together. And then one day she came crying to the OPD and she said कि मेरे ससुराल वाले मुझे निकाल रहे हैं क्योंकि वो सोचते हैं मेरे को कैंसर है, तुम्हारे इतने दिन से ये ट्यूब पड़ी हुई है, इसका मतलब कुछ गड़बड़ है. So I said, no, next time you come, you bring your husband and whosoever is there to me. And I sat down with the family in the OPD, explained to them everything. And then fortunately the secretions became less and less. We could remove the tube and she was accepted back into the family. And she sent me a WhatsApp message in the middle of the night sending a picture of her baby. And then every few months she tells me कि अब मेरा baby इतना बड़ा हो गया, इतना बड़ा हो गया. So this is one family who is from Bihar and they brought some food. Now as a rule, I would not accept gifts from patients. Why I said accept? Again, I remember when I was a resident, so AIMS में Afghanistan से patients आते थे. There was this connection because the children's hospital in Afghanistan, Kabul, was being managed by AIMS at that time. So there was this gentleman who came with enterocutaneous fistula, and we looked after him for weeks and months together, and finally he became all right. So he came to me in the hostel and brought a packet. तो उसमें I think कुछ dry fruits थे अफगानिस्तान और एक साड़ी थी. He thought I am married. I was not married at that time. और एक शर्ट थी. तो उस समय तो मैं बहुत ही ज़्यादा प्रिंसिपलिस्टिक होता था. विद एज आपके प्रिंसिपल्स भी डाइल्यूट हो जाते हैं. तो आई जस्ट सेड नो, गेट आउट फ्रॉम माई रूम. और वो गुस्सा हो गया. एंड देन इन हिज टूटी फूटी उर्दू ही एक्सप्लेन टू मी कि आपने मेरी इंसल्ट कर दी है. बिकॉज आई थिंक इन इस्लामिक रिलीजन इट इज़ नॉट courteous to refuse a gift. एंड या शायद अफ़गान कल्चर ऐसा है. तो फिर मेरे को उसकी बात समझ आई तो मैंने उससे वो ले लिया. फिर मैंने उसको बोला कि भाई मेरी तो शादी नहीं हुई है, साड़ी का मैं क्या करूँगा. तो सेड नहीं, वापस तो हम कोई गिफ्ट नहीं ले सकते. तो देन आई केप्ट इट एंड देन आई गेव इट टू अ लेडी विद corrosive stricture whom Dr. Chatterjee had operated when she was being discharged. So I gave it as a gift to her. I said, you are like my sister, you take this sari from me. So this patient brought some food and in the OPD I ate some food. So patients have to be priority. But unfortunately हम ज़्यादातर लोग कोशिश करते हैं कि जो the so called VIPs हैं उनके साथ रिलेशन बनाएं. बट मुझे ज़्यादा अच्छा लगता है कि जब मैं जो वेरी इंपॉर्टेंट पेशेंट्स हैं उनके साथ रिलेशनशिप बनाऊं. सो दैट इज़ वाई इवन आफ्टर 30 years इन लखनऊ आई स्टिल डू नॉट हैव एनी IAS ऑफिसर और मिनिस्टर्स कॉन्टैक्ट इन माई कॉन्टैक्ट लिस्ट. फ्रेंड्स आर इम्पॉर्टेंट. नाउ फ्रेंड्स कैन बी स्कूल फ्रेंड्स. माई oldest non-family relationship today is from Rajghat Basement School. उसमें से 2-3 लोग हैं जिनके साथ अभी भी कॉन्टैक्ट्स हैं. हम उनके बच्चों की शादी में जाते हैं, वो हमारे बच्चों की शादी में आते हैं. हमारे बच्चे जब US में हैं जहाँ, तो जब हम जाते हैं तो उनके बच्चों से मिलते हैं, वो जाते हैं तो हमारे बच्चों से मिलते हैं. Also it is important to have friends whom you may not be meeting very frequently. You just meet them at professional meetings, but you know कि वो आपके वेल विशर हैं. अगर उन्होंने आपको कोई एडवाइस दी है तो आप उसको आँख मूंद के फॉलो कर सकते हो. एंड वन ऑफ देम इज सिटिंग हियर इन केस यू डोंट रिकॉग्नाइज हिम. एंड एज आई सेड, द नेक्स्ट प्रायोरिटी फॉर अ टीचर आर हिज स्टूडेंट्स. सो दिस इज ओनली वन बैच. As was mentioned, I think more than 100 or maybe even 150, I have lost counts. Students have gone through SGPGI, and now I'm fortunate that I'm still continuing as a teacher. So students, these are my research students. आप उनके उससे देख सकते हो कि research students as opposed to clinical students are more free. वो जैसे भी ड्रेस होती है, क्योंकि वो रात में कभी काम कर रहे हैं, अकेले लैब में काम कर रहे हैं, तो वो घर भी आ गए हैं. आई एम ऑल्सो इन अ कैजुअल ड्रेस, सो दे हैव ब्रॉट अ केक फॉर माई बर्थडे. सो दीज आर सम ऑफ माई रिसर्च स्टूडेंट्स. देन दे कॉल यू व्हेन दे ऑर्गेनाइज मीटिंग्स. जैसे संजीव ने इतनी बार मुझे बुलाया. दिस इज शबी अहमद, द टॉल वन, who is now the chief of surgery at Allahabad. I'm just showing some sample pictures. Then they take you out for dinner also. This is Himanshu, who is now in Agra, and his wife Nisha. That's my wife Lily. Actually, she was to be here. She should have been here, but because of a family commitment, some guests, and guests भी ऐसे नहीं. मेरी साली है, उनकी बहन है, वो ऑस्ट्रेलिया से आई है, तो it was not possible for her to come. Then they also take you to show their hospital. I still remember संजीव का जब बन रहा था तो संजीव और निभा ने मुझे दिखाया था. महिंद्रा जब यहाँ अपना नरवरिया, डॉक्टर नरवरिया, उसका जब बन रहा था तो वो मुझे अपना दिखाने के लिए ले गया था. So many of you have taken me around and shown me your venues. Also, their children. This is Joy's children when I went to their home. This is again Nisha. When she came to Jaipur, they visited our house. So, students obviously become part of your family. This is Deven Nayak, who is in Raipur. Again, one of my students. He has a big medical empire today. And कौन सी गाड़ी है? अरे जगुआर. तो हम जब वहाँ पहुँचे तो उसने वो खुद लेके आया. शॉफर वाज सिटिंग ऑन द सीट बाय साइड, एंड देन ही सेड कि ये. अब मैंने कहा भाई ये गाड़ी मेरे को नहीं, तेरे पास और भी गाड़ियाँ हैं, दूसरी गाड़ी मुझे दे दे. ही सेड नहीं नहीं आप इसी में जाएंगे. सो दैट इज़ मी पॉइंटिंग आउट दैट. तो अब संजीव ने तो पब्लिश कर दिया, मेरी तो अभी पब्लिश नहीं हुई, लेकिन मेरे हैंड रिटन नोट्स हैं. तो उसमें जो एक चैप्टर का टाइटल है, क्योंकि उस समय मेरे पास मारुति थी, ओन मारुति बट राइड जगुआर. Leadership also is important, and as Sanjeev has also written, that leadership needs to be created. You don't have to have a position to become a leader. Position is if you want to become an administrator, and leader, even if you don't have a position, you can lead. So that is a picture of me from my MBBS days. That's also an interesting story. I was in second semester, that means first year MBBS, and traditionally एम्स की स्टूडेंट्स यूनियन में फर्स्ट ईयर वालों के लिए 3 ही पोजीशन होती थी: क्लास रिप्रेजेंटेटिव, सोशल सेक्रेटरी, एंड आई थिंक स्पोर्ट्स सेक्रेटरी. नेक्स्ट हायर पोजीशन वाज फाइनेंस सेक्रेटरी, विच ट्रेडिशनली वेंट टू अ 4th सेमेस्टर और सेकेंड ईयर स्टूडेंट. तो उस साल जिस स्टूडेंट ने 4th ईयर का नॉमिनेशन भरा, ही वॉज नॉट अ पॉपुलर स्टूडेंट, ही वॉज अ बिट नोटोरियस काइंड ऑफ student. So a lot of my friends suggested, why don't you file your nomination? So it was the first time that a second semester student became a finance secretary of the students union, and that helped me because उस समय हम अपने जो प्रेस रिलीज या जो भी इशू करते थे खुद टाइप करते थे. उस समय फोटोकॉपी नहीं होता था, साइक्लो स्टाइलिंग मशीन होती थी, तो हम खुद उसको साइक्लो स्टाइल करते थे. फिर मुझे थोड़ा बोलना आ गया, क्योंकि स्पीच कभी कभी देनी पड़ती थी, एडमिनिस्ट्रेटर्स से कैसे बात करनी है वो आ गया. एंड देन इट वेंट ऑन टू बिकम द प्रेसिडेंट ऑफ द रेजिडेंट डायरेक्टर्स एसोसिएशन, जहाँ बहुत स्ट्राइक्स भी करी, बहुत धरने भी दिए, बहुत डेमोन्स्ट्रेशंस भी किए. इवन ड्यूरिंग एमरजेंसी वी प्रोटेस्टेड, विच वॉज अ वेरी रेयर थिंग. एंड देन ऑफ कोर्स आई कंटिन्यूड एज द सेक्रेटरी एंड प्रेसिडेंट ऑफ द फैकल्टी फोरम एट SGPGI. बट lead by example. Don't preach what you do not or what you cannot practice. So that's very important. और आजकल तो बच्चे और ज़्यादा स्मार्ट हो गए हैं. They know कि आप जो बोल रहे हो आप खुद तो करते नहीं हो, हमें क्यों बोल रहे हो. So if you say something, first you should be doing it, and then only you should be telling your students. Or at some stage, at least I feel, one should retire. And retire not in the semantic meaning of the term. Retire means that you should change the way you work or change the way that you spend your time. So now when I have moved to my new assignment, I came with an intent, came with a purpose, and that is why I was seeking a platform like this, where I could be allowed to do what I want to do rather than being told to do that you have to do this. And I know that indirectly behind the scenes, Dr. Adarsh played a role in my moving from SGPGI to this hospital, because the chairperson emeritus, or the Sarve Sarva of the hospital, is a very good friend of Dr. I didn't know about it. I never spoke to him about it. He never talked to me about it. But I know that he played a very important role. So here I am more like a, should I say, a coach. So there is a team, which is a good team. They are playing, they are batting, they are scoring good runs, but I am there. And that is me sitting on the stool there, corner. So they know that I am there in case they need me, in case they want me, in case there is a problem. I am there as a cover, I am there as a cushion to protect them, either from the administration or from whatever, and they can bank upon me. And I am doing what I want to do rather than being told what to do. And in return, what do you get? You get an attention and affection like this. So I will explain what this picture is. So on the grey pen is the one which I was carrying in my pocket. और वो गिर गया था और शायद मेरा पैर उस पर पड़ा तो वो दब गया थोड़ा सा, but it was working. So that is the pen I was using. Next day, one of my young faculty colleagues, Vinay Mahala, who is trained from KEM, and he has been with me only for 1 year. उसके पहले मेरा और उसका कोई बहुत ज़्यादा interaction नहीं था, which I can say that he has a personal relationship with me. He says, सर वो आपका पेन खराब हो गया है, आप वही वाला है क्योंकि आपको वो अच्छा लगता है, ये आप नया वाला यूज़ करो. So that is the kind of attention, affection you get from your students. He's not my student now, he's a young faculty colleague, but it makes you feel happy. अब संजीव ने कहा कि मुझे कुछ टिप्स भी देने हैं, कुछ लेसन्स भी देने हैं, तो ओनली फॉर दैट पर्पज़ आई डोंट थिंक आई एम गोइंग टू गिव यू एनी टिप्स, बट जस्ट अ फ्यू स्मॉल थिंग्स. रीडिंग इज़ वेरी इंपॉर्टेंट. आजकल मैं नहीं पढ़ता हूँ, आजकल मैं लिखता ज़्यादा हूँ, बट आई यूज़ टू रीड एंड रीड एनीथिंग एंड एवरीथिंग. मैं बहुत बार देखता हूँ लोग फ्लाइट में बैठते हैं, उसकी मैगज़ीन भी निकाल के नहीं पढ़ते हैं. आई फील वेरी इरिटेटेड कि ऐसा कैसे हो सकता है कि आपके सामने कोई किताब रखी, आप उसको पढ़ ही नहीं रहे हो. यू हैव टू रीड. जो भी चीज़ अब इसके पीछे भी एक स्टोरी है. माई फादर प्रोबेबली ही यूज़ टू कम बैक ऑन साइकिल फ्रॉम द ऑफिस टू द होम, और वो शाम को लौटते हुए मम्मी कुछ बोलती होंगी कि आज ये ले आना, आज वो ले आना. तो पहले तो पॉलीथीन नहीं होता था, तो अखबार में ही लपेट के चीज़ें दी जाती थी, तो अखबार में लपेट के कुछ लाए होंगे घर पे, आई डोंट रिमेंबर व्हाट. उसमें उन्होंने पढ़ा कि गवर्नमेंट ऑफ इंडिया की एक स्कीम है फॉर scholarship in residential schools, and that is how I went to Rajghat. So read everything, जो भी मिल जाए उसको पढ़ लो, कहीं ना कहीं काम आ जाएगा. And then you have to develop the scanning skills of reading. कुछ लोग होते हैं कि आज मैं कॉलेज से घर गया, अगर ऐसे पढ़ेंगे तो वो तो फिर पूरा नहीं पढ़ पाएंगे. You have to scan the document and pick up what is important, what is relevant. And this, I looked at the dictionary. It is said कि स्कैनिंग रीडिंग स्किल इज़ लाइक पर्ल डाइविंग, कि जो पर्ल डाइवर होते हैं वो नीचे जाते हैं और पर्ल उठा के 2 मिनट के अंदर वापस आ जाते हैं. एक्चुअली मैं 2 साल यूएई में रहा, तो पर्ल डाइविंग वॉज द प्रोफेशन ऑफ द यूएई पीपल बिफोर ऑयल केम इन. तो वहाँ बच्चे भी, औरतें भी और बूढ़े लोग भी वो ये स्किल्स डेवलप करते थे कि कितनी देर सांस रोक सकते हैं, और उतनी देर सांस रोक के वो दे वुड गो इनटू द डेप्थ ऑफ द सी एंड पिक अप द पर्ल एंड केम बैक. दैट इज़ व्हाई माय बुक इज़ नेम्ड पर्ल्स इन सर्जरी, क्योंकि ये मैंने वहीं पे लिखी थी. एंड देन द स्टूडेंट्स यूनियन एंड रेजिडेंट डॉक्टर्स एसोसिएशन गेव मी द ड्राफ्टिंग स्किल्स, कि कैसे अपनी बात को आपको लिखना है ताकि दूसरा आदमी उसको समझ पाए. एंड दैट इज़ व्हाट पीयर रिव्यू इज़. अगर आपने आर्टिकल लिखा है और वो रिव्यूअर को या पीयर रिव्यूअर को नहीं समझ आया, एडिटर को, तो वो तो फिर रिजेक्ट कर देगा. So you have to know the drafting skills and you need to know how to summarize. अब हमारी मीटिंग्स में बहुत सारे लोग होते हैं, अक्सर हम देखते हैं कि they would stand up, make a comment for 5 minutes, but at the end of it, probably they also don't know what they wanted to say. So you should be able to say what you want to say in not more than 1 minute. That should be good enough. Time management, of course, is important. We are all so busy, obviously first with patients, then teaching, studying, research, whatever. थोड़ा बहुत टाइम फैमिली को भी देना पड़ता है, मजबूरी में देना तो पॉसिबल नहीं होता. So time management, multitasking is very important. At any given point in time, you should be doing at least a few jobs. Not कि पहले एक काम खत्म हो जाए और दूसरा शुरू करूं. If there are any students and residents, you have to be omnivorous and omnisomnous. Eat whatever is available, sleep whenever you can. ये अगर दो है, अब I can sleep, मैंने ट्राई नहीं किया, but I am sure I can sleep standing also. अगर इधर उधर सपोर्ट है तो मैं खड़े होकर भी सो सकता हूँ. सो दैट इज़ वाई आई हैव नेवर डेवलप्ड अ जेट लैग इन नंबर ऑफ विजिट्स टू यूएस, बिकॉज मैं जैसे ही बैठता हूँ, अभी तो मेरे को फॉर्चुनेटली मेरे हॉस्पिटल एडमिनिस्ट्रेशन ने गाड़ी भी दे दी है, क्योंकि उनको मैंने बोला कि मैं ड्राइव नहीं करना चाहता हूँ. हॉस्पिटल इज़ अबाउट 15 किलोमीटर्स. द मोमेंट आई सिट डाउन इन द कार, आई क्लोज माई आइज और आई टेक अ नैप. तो वो हैबिट बड़ी अच्छी है, उससे आपको अच्छा रिलैक्सेशन हो जाता है. Few things which I feel are important. Yes, you should not be talking much, but if it comes to saying something which you feel strongly about, then you should say it. Whether the other person likes it or not, that much guts and spine you should have, because brain without spine has no meaning, because it will lie on the floor. If there is no spine, the brain will be lying on the floor. Perfection, yes, nobody can achieve perfection, अगर हम ट्रू डेफिनेशन देखें, बट स्टिल यू शुड ट्राई टू स्ट्राइव फॉर इट, एंड दैट इज़ व्हाट आई लर्नड, एज आई सेड, फ्रॉम डॉक्टर नायक. ऑल्सो, as was shown in one of the cartoons, that you have to be listening. You have to be listening, and I feel you have to be listening more to those who do not speak your language, who are not talking the same thing as you are doing, because those who are speaking the same language as you want to hear, they are probably not speaking the truth. And as has been emphasized by everyone, relationships are definitely much, much more important, whether it is with patients, students, family, friends, as compared to money. Another thing which I personally am very particular about, that it's very easy to shout at somebody who is lower than you in the rung, whether in the family, in the social circles, in profession. But if you have the guts, you should be able to speak in a loud voice to somebody who is above you. If you feel strongly about what you are saying is right, then you should have the guts to talk loudly. Most of us, हाँ सर, जी सर, ऐसे करते हैं, और जब हमारा नीचे वाला होता है उसको उसकी गलत बात पे भी मतलब सही बात पे भी डांट देते हैं. I personally feel that is not correct. Unless, and I would say even if you belong to a rich family background, in the initial years, for my young colleagues, you should live a frugal life. So it doesn't matter if your father is a millionaire, billionaire, or whatever. When you are a trainee, when you are a young person in the profession, live a frugal life, live on what you are earning, not what your parents are giving you, and save for future. And of course, today it is very important, and I put social media also in that these are all very easy to get addictions. I see people, as was pointed out, I think by Dr. Adarsh also, that even in important meetings, even in important discussions, even in gatherings, people are addicted and stuck to social media. I think it's one ill which we have to be very, very careful about, especially for our children and our grandchildren. So this is a picture, I asked Sanjiv, because I had only this picture. I think उस समय भी इतना ज़्यादा वो नहीं था. So that is Dr. Nundy, and this is Sanjiv's first book which was being released. Sanjiv is there, although he is not seen. I asked him whether he has a better picture, but he also could not find one. So I'm grateful that I was there even at his first book release, and I'm here at his second book release also. Now, what is the competition between Sanjeev and me. Ideally, there is no competition between a teacher and a student, a mentor and a trainee. But एक पुरानी कहावत है, वो थोड़ा सा शायद नेगेटिव उसमें है या सरकास्टिक मीनिंग में है कि गुरु तो गुड़ ही रहे और चेला चीनी हो गया. But I think that should be taken in a positive way. Every guru should aim for his chela to become the chini, to go farther than him or her, because that is how the society will progress. If those whom I am teaching and training, they do not achieve the same level or even higher level than me, how will it progress? फिर तो वो standard नीचे नीचे जाता जाएगा. So I am very happy to say that in terms of publishing books also, I am following Sanjeev. He released his book first and then I followed with my book. And now again, I am still to scribbled notes on virtually the same topic, which I have to compile and give them a shape, and Sanjeev has already gone ahead with it. So I am very happy, I feel very proud, I feel satisfied that he has been able to do something which I will probably do after a couple of years. I do agree with most of the things which, because I will be asked to comment on the book, so I might as well do it now. So I agree with most of the points which Sanjeev has made. Some of these things are very, very important, but there has to be, and this one, so that's my hobby, writing on non-medical topics also. This one is published. The one on India quiz is on Kindle, and Ramayana quiz is almost getting ready. This also is important. So as I said that when we were young and middle level of profession, we couldn't give time to our family, especially our children. Same thing what Sanjeev has mentioned, parent-teacher meeting, homework, exam, everything is shouldered by the spouses who even sacrifice their own career, their own ambition. But now I'm trying to do that with my granddaughter, although she's in US, so we have virtual interactions with her. Hopefully next month we would be going and spending time with her. So better late than never. Now I'm trying to strike a balance between work and life. But there are a few points where I will not disagree. I have my opinion. He has his own opinion. He's also right. I'm also right. He says take calculated risks. I play very safe in my life. I don't take any risks at all. Wherever I feel there is a small risk, I keep away. For example, in conferences, I don't go very close to Dr. Adarsh because that's very risky, so I stay away from him. Spiritual, I know Sanjeev is very deeply spiritually inclined. Again, like Dr. Adarsh, I am not a religious person. My maximum religious activity was when my mother would say, ki aake puja mein baith jao, I would go and sit there. But on my own, only time we went to temple was when we were students. तो वो एम्स और सफदरजंग के बीच में एक छोटा सा हनुमान मंदिर था. Every Tuesday, again because of some of my friends who were religiously inclined, हम वहाँ जाते थे. मैं ज़्यादा प्रसाद लेने के लिए जाता था, but now I don't. So, but I compensate for that, thinking that my work, whether it is patient care or now more teaching, is my religion. If I can do that religiously, it is fine. So if you are a young faculty member, you are working in a government hospital where Sunday is a holiday, जैसे लोग संडे को चर्च में जाते हैं, फ्राइडे को नमाज पढ़ने जाते हैं, आप सोचो कि मैं संडे हर रोज़ राउंड करने जाऊंगा, दैट इज़ योर रिलीजन. आपको सेटिस्फैक्शन मिलेगा, पेशेंट खुश होगा, डॉक्टर साहब संडे को देखने आए, सीनियर डॉक्टर दूसरे डिपार्टमेंट में तो नहीं आते हैं, स्टूडेंट्स थोड़ा डिसिप्लिन हो जाएंगे, वो टाइम से आएंगे और दो चीज़ उनको पढ़ा दो. सो दैट इज़ योर रिलीजन. एंड वाई इवन हैव स्ट्रेस? Have a stress-free life, so you don't have to manage stress. Don't take anything as a stress. So these are some points where I have little different. There are, he also wants me to talk about regrets. छोटी-छोटी regrets हैं. I'm very poor in medical technology. कोई मेरे को बोले हार्मोनिक या कूसा का ये adjust कर दो. I don't know. Even after spending 30 years in theatre, I have no knowledge of. Some of my friends, some of my colleagues have very good knowledge of technology. I have not been a skilled, like Dr. Bhatia, I have not been a very skilled minimal invasive surgeon. I have not even touched a robot, although I wish to, but I don't know whether now I will, क्योंकि जब तक मैं सीखूंगा तब तक तो खत्म हो जाएगा. लिवर ट्रांसप्लांट इज़ अनदर थिंग, ऑल्दो उसमें भी बड़ा इंटरेस्टिंग है. अभी जब मैं महात्मा गांधी हॉस्पिटल में गया तो एज आई सेड आई हैव ए वेरी गुड टीम एंड वी हैव सपोर्ट फ्रॉम गंगाराम हॉस्पिटल, डॉक्टर नैमिष मेहता हु इज सपोर्टिंग अस इन ट्रांसप्लांट. सो नाउ बस 2 minutes, sorry, I'm so sorry. So we are doing 3-4 transplants a month. So in Jaipur and Rajasthan, I am known as the liver transplant surgeon because I am the head of the team. Another small regret is that I never learned not to be not nice. Sometimes I feel कि if you are very nice, sometimes people tend to take you for granted. So although given a chance, I would again not be not nice. स्पोर्ट्स हैज़ बीन माई वीक पॉइंट, नेवर प्लेड एनी स्पोर्ट. और अब एक प्रॉब्लम हो गई है कि नाम भूल जाता हूँ, तो बड़ा एम्बेरसिंग हो जाता है. लोग मिलते हैं जिन्होंने मुझे इनवाइट किया, इवन अब्रॉड होस्ट किया, एंटरटेन किया, फेलिसिटेट किया, एंड आई डोंट रिमेंबर देम. समटाइम्स इट बिकम्स वेरी डिफिकल्ट. बिग रिग्रेट, बिग रिग्रेट. Same as many of us. We could not give enough time to our parents. Should I say thank you to Sanjiv for this? No. I should not, I will not. Because I don't say thanks to these two young people who are my sons. So I never say thank you to them. And even Sanjiv doesn't have to say thank you to me. Because that is his right. If he calls me, that is his right. And I have to come because it is my responsibility. Do I have to say thanks to Niba? I don't know. I was thinking. So when these two young ladies became part of our family, I had the same debate. So Niba, you are much senior to them. They came only 5 years ago and 1 year ago. So I won't say thank you to you also. But I would like to thank all of you for being here, for giving support to Sanjiv and Niba, and for making this what he calls CME, but I think it is a continuing moral education, successful venture. Those of you who are in medicine, surgery and oncology, this is a meeting that we are organizing. You can join online using this link. I'm sorry I overshot the time. Thank you. Thank you very much.
It was an indeed emotional. It was an emotional moment for all of us, and we thank Dr. Kapoor for his elaborate way on views of the professional life. Now I request Dr. Parveen Bhatia for his lecture. Dr. Parveen Bhatia did his MBBS from prestigious Miss Maulana Azad Medical College, New Delhi, and MS from Ram Manohar Lohia Hospital, New Delhi. He got trained further in overseas centers under various stalwarts of the field. He is one of the pioneers as well as flag bearers of minimal access surgery in our country. Currently, he heads the Department of Minimal Access Surgery at Sir Gangaram Hospital, New Delhi. Dr. Sanjiv Haribhakti remembers him for his dedication for his very inspiring online Sunday stories. Dr. Bhatia was invited for a CME at Ahmedabad. He called up Dr. Haribhakti, find out some exotic location in this city for his Sunday story where he could shoot. Both of them went to Sabarmati riverfront, and Dr. Haribhakti shot the narration of Dr. Bhatia there. For today's visit also, Dr. Bhatia requested Dr. Haribhakti for some exotic locations, so both of them went to Statue of Unity to shoot the film. Over to Bhatia, sir.
Can we shift now? Thank you very much. First of all, I must thank Dr. Nibha for calling us one. Second, allowing Dr. Sanjiv Haribhakti to do his surgery training in AIMS and in Lucknow when they were married even, and then to start a hospital of that magnitude, and then to carry on writing books after books. I must say that all thanks to Dr. Nibha rather than to Dr. Sanjiv only. And honestly, when we met in the last CME, I was thrilled that Dr. Sanjiv Haribhakti has written a book which is very, very close to our heart, Big 5 Lessons of Life. And believe me, after reading once, cover to cover, I had to restart and underline the book so that ultimately I am still the student. I am trying to unlearn, learn, and relearn. And that has been my passion for last so many years. I must thank, in the same spirit, Dr. Adarsh Chaudhary. He has been my mentor for last decades, 3 or 4 decades, and he is responsible for whatsoever I am going to speak today. And in the end, I would not miss an opportunity to thank Dr. Indu Bhatia, my wife, who, in spite of my Sunday stories, my presenting all these, she has come here to listen to me also. Thank you very much. And in this photograph, are you able to see the earth? Are you able to see India? Are you able to see Sir Gangaram Hospital and Bhatia Global Hospital? Are you able to see Parveen Bhatia in this? So why ego? Why me? Why I? Our thoughts are that we have to tell our younger colleagues that we just had an existence which is non-existing. And ultimately, we will too shall pass away. And we have to pass on the messages. As frankly speaking, when I went to, both of us, Indu and me, went to Masai Mara, we were surprised when we were taken after the visit to Masai Mara National Reserve to this airport. Can you imagine? This is an airport. We are standing on an airport and we had to take a flight from Masai Mara to Nairobi on such a airstrip. So this is the existence. Oof, you are gone. What I mean to say, we care so much for us, but ultimately my motto in life has been inspire or expire. If I am able to inspire the younger colleagues, my job is done. And if I am not able to inspire the people, I should expire. I should not be existing. So that is the thought that always keeps me motivated and keeps me in the line so that ultimately I am able to sum up. And I would say Dr. Sanjiv Haribhakti did an injustice to all of us today. He should have allowed us to speak for hours and hours, and then I could have spent maybe full whole day to tell you so many lessons which I have learned in my life. So I phoned him, do you want life lessons or do you want surgical lessons? He says life lessons. So he says that you have to sum up your presentation in 20 minutes. In 20 minutes, if 5 lessons have to be projected, then it becomes challenging. And it took time for me to present, and I would be dwelling in next 18 minutes on this. First lesson of my life has been cut 1 mark if possible. Second lesson has been it's all about finding the calm in the chaos. Third lesson is stay positive. will surprise you by my positive energy level. And lesson number 4 is respond but never react. And 5th lesson, and to me that is the most important surgical lesson also, a split second becomes eternal. And I will spend few minutes, 3 slides each on these 5 lessons, and I will complete my job. When I was a student in class 9, 10th and 11th, in mathematics paper, I used to write at the end of it, cut 1 mark if possible. And teacher could not cut it. And can you imagine, I was carrying that emotion, and I was telling my younger colleagues in Gangaram Hospital as well as in Bhatia Global Hospital that today you have done lab Koli, is it possible to cut 1 mark or not? Yes sir, I have done my best. That's it. That means you are trying to do your best, and that is the way I have also been operating throughout my life, that isme ek bhi number katna nahi chahiye. I should give my best to the patient, and then only patient's best will come back to me. And can you imagine, I operated on a patient recently, and my habit is that I ask the patient on the table before the induction, what are you going to do? So that I make them relaxed before they go in for induction. So I asked her, what are you doing? So she says that I am a mathematics teacher. So I told her that in mathematics, I used to score 100% marks, and I used to write at the end of the paper, cut 1 mark if possible. She says, ho hi nahi sakta. How is it possible? Could your teacher cut 1 mark? I said, no. Then after follow-up, then I asked her, can you now tell me that how could I write this? She says that nobody can write it. I said, I have been writing it. If you say that I am lying, it's up to you. And I told her that my policy in life has been check, 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 cross-check, counter-check, check and check. And I have not been checking the question from the top to the bottom, but I have been checking from the answer to the question. So this is the way I have been doing all the workshops, all the conferences, all the presentations, all the surgeries, so that ultimately check, 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 recheck, cross-check, counter-check, check and check has become famous with my name. I would put it this way. And again, for younger colleagues, I would tell them that even if you are going through hell, keep moving. That is the only way you will come out. There have been many situations in life also, in surgery also, that if we are passing through or we are doing a rough kind of operation, we are not able to get the Callet's anatomy, for example, but patience brings patients, patients bring patience. So our thoughts are that please carry on moving, never ever give up in life, and you will be able to come out of the hell. And as has been presented in the morning also, that we should always remain intensely focused. If we are focused, what we are going to do, and our intensity is there, our consistency is there, and Dr. Chaudhary pointed out to me that you should boast of this newsletter. I said, no, I should not. But he says, no, when we started our newsletter from Global Hospital, it was in November 2001. And he told me that around 18% of the journals die down in 2 years. So you should be sure that if you have such substance, then only publish a newsletter, otherwise please don't start it. And God has been ultra kind that we have been able to publish the newsletter for last 22 years, and every month on 22nd of month, it goes to 6,000 people all over the country, and we have been able to contribute maybe a small drop in the ocean. So our thinking is, 1, the intensity, and 2, the consistency has to be there. And for this, and especially for my younger colleagues, I must say the lessons of my life is that we have to be disciplined. Disciplined would mean, how can I be disciplined? I have this habit of getting up at 4 a.m. for ages now. And at the time of getting up, And at the time of waking up, the time should be, interval should be 0. When I start teaching my younger colleagues, telling my younger colleagues that the time between waking up and getting up should be 0, then how can it be that I will carry on sleeping? So I have to get up, and after getting up 4 a.m., doing physical exercise, weightlifting at this age also, strenuous weightlifting at this age also for 1 hour, and then I go for morning walk and so on and so forth. But can you imagine, Dr. Chaudhary gave me a phone call a few days back, and he says that, what are you doing? So I told him, I am connected to the connective tissues. I was doing a hernia, and I was feeling as if the bilaminar fascia transversalis is meant for us. The God has created the planes only for us, the surgeons. So why not work in those planes? The vessels are away. Why should we not respect the anatomy? Once I am connected to my own self, once I feel God lies within me, devil also lies within me, enemy also lies within me, tissue I have to respect, then only the tissue is going to respect me. So that is the thought, that either suffer the pain of discipline or suffer the pain of regret, and never ever quit. This is me. Inside the frog is in me. I am in the mouth of the stork, and I am trying till the last moment that I will never ever give up, and ultimately many times the stork is dead, the frog is still playing. Lesson number 2 is, when I am operating, and there will be some situations, day before yesterday when we started from New Delhi, then my wife, being a laparoscopic gynecologist, she was operating on a very, very challenging hysterectomy. And it was all adherent to rectum and every structure. So she called me, she called for help, that is very good. But when I started operating, because I had to take the flight in the evening, I had to operate one of the obstructed hernias in Sir Gangaram Hospital. So I was carrying on reinforcing in my mind, calmness is superpower. Calmness is superpower. Suffer mein nikloge, dhoop to hogi hi. And it is all about finding the calm in the chaos. And once that kind of habit is there, that chaos will be there. Difficult anatomy, difficult surgery, difficult situations will be there. But if you are able to calm yourself throughout, then definitely you will be able to come out in the end. And lesson number 3 will surprise you with my positive energy level. This is my tagline on my WhatsApp, and it has been there for ages now. Our feeling is that most of us are not positive. We are living the life of a makhi. There is a difference between makhi and madhumakhi. Makhi is that it will always find out wherever there is a shit, it will sit there. But whereas a honeybee will always find a flower, even if lot of shit is there, but always will find a flower, suck the nectar and do the job. So what I mean to say, be a madhumakhi and not a makhi. Remain positive. Don't try to find out the weather is not good. You go to the hill station and then they start saying that a lot of cold weather is there. So you have come to a hill station. Why should you crib? You enjoy that weather. You enjoy everything. And believe in yourself. That is a very, very important. Most of the times, I would put it this way, that we start competing with each other. I think, let's be very straight about it. We have to compete with our own self. Why should we compete with others? I remember a small story of frogs that they announced that on this day in the morning at 7 a.m. they will be racing towards the top of the mountain. And as the frogs started running, more onlookers had collected, more criticizers had collected, and they were cheering up, and they were very, very happy when one frog falls down, second one falls down, third one also. But ultimately, at the end, one frog could reach the top of the mountain. Those onlookers, those criticizers, they told the frogs that find out how could it be that that frog has reached the top of the mountain and not you. And then any and every frog started giving an excuse. Oh, I am doing so much, I am earning so much, why should I work hard? I am having enough, I am spending time with my family, and so on and so forth. But ultimately, they were not interested in finding out that why did you fall off. They were interested in how that frog reached the top of the mountain. And then when they interviewed the frog carried on smiling. Frog carried on smiling. They were surprised. How could it be? He is not answering us. And would you be surprised? Frog was deaf. Frog was deaf to the criticism. He was looking at the onlookers, he was looking at the criticizers, that, oh, cheer up, but he was always thinking that it is all cheer up. They are not critics, and he could carry on and reach the top of the mountain. And believe me, you have to decide within your own self to be happy. There is nobody can make you happy or unhappy. You have to decide within your own self that you have to remain happy. And this was the lesson which was given to me by my late Professor Dr. B.S. Rana from Maulana Azad Medical College. We were recently married in our post-graduation days in Maulana Azad Medical College. And anytime and every time, he says that any fool can do the surgery. Any fool can learn surgery. You have to learn the values of life. And I was always thrilled. And one day he said, respond but never reacted. So I thought, honestly, I thought that he must have overheard that yesterday night both me and wife have fought with each other. So he was giving respond but never react. No, our thoughts were, whenever some situations are there in laparoscopy, in surgery, in life, if we have a habit of not reacting and we just respond, our job is done, and this too shall pass. Time is the best healer. Would you be thinking about the Buddha story? One day, somebody spat on Buddha, and Buddha never responded, never reacted. The same night, the person could not sleep, and he came next day only, sir, I am very sorry. I have found out that you are a great person, and I did a mischief, and I spat on you because somebody else had told me. I am very, very sorry. Buddha never reacted. And after 5 days of remorse, repenting, that man came back again and said that, I am surprised that how could it be that when I spat on you, you never responded, never reacted. When I came to say sorry, apologize, then also there was no reaction. What was the answer of Buddha? He said that if you had come 20 years before, I would have done the same. I would have reacted when you had spat on me. I would have also maybe beaten you. And when you praised me, then I would have embraced you. But now I have gone beyond, and I have gone within myself. I do not want to react to any situation. I just want to respond. And I think this very lesson has paid me very much in my life, and I want my younger colleagues, my children, also learn this, that there will be n number of situations in surgery, in life, that when the situation can be deteriorated by just a reaction or an overreaction. So respond, never ever react. And the last lesson is a split second becomes eternal. And for example, if somebody is operating the gallbladder surgery, or if distractions lead to disasters, many of us carry on attending the phone calls from home or wherever, whenever, and if you injure the CBD, I always tell my younger colleagues, you are going to make this patient or this person a biliary cripple. A split second becomes eternal. So just think about it. When I do bariatric surgery, at the clipping, at the stapling, I always tell, please, the last stapler has to be fired. When there is doubt, there is no doubt, because 70% of the leaks will be at G junction. So split second becomes eternal. You will try to think that you are saving the cost of one cartridge, but imagine the cost of the complications which the patient is going to suffer in life, that is very, very important. So my thinking is, most of us, I'm so sorry, I get pained that most of us are not sensitive to the patients. Most of us are either counting money or counting our hours, how many hours we have worked. We should be sensitive, especially my younger colleagues should be sensitive to the patients. Patients should be treated as my mother, my brother, my sister, and then only I should do the surgery. Otherwise, I should not be allowed to do surgery. And in the end, I would just sum up with one small story. And for this, बहु बीती थोड़ी रही, बहुत बीत गई, थोड़ी रही, पल पल गई बिहाए, एक घड़ी के कारणे मत कलंक लग जाए. What I mean to say that just you have done such great job throughout your life. You have operated so many surgeries. But if you do one mistake and ultimately the patient has cascade of events, your job, your life, your sensitivity is gone. So our thinking is that once we have done so good with our friends, with our relations, with our family, so why should we do anything which will ultimately kalank our life? So the story is that there was a king. He called all the kings, big 5 kings from all over the world, and they were sitting in the evening with him, and he called one prostitute or a tabayaf to do the night singing throughout night, and he called his guru also, and the king gave the envelope of ashrafis, the coins, to the guru, and he instructed that whenever you feel that she has recited a beautiful couplet or she has done a good dance, then you can give her the money. And would you be surprised, at 4 a.m., the tabalchi who was with her singing, and so he started dozing off. And when he started dozing off, she used this couplet, बहुत बीती, बीत गई रात, थोड़ी सी रही, पल पल गई बिहाए, एक घड़ी के कारणे mat kalank lag jaye. If you doze off now, if you sleep off now, whole of my dance, whole of my night, everything will be wasted. So he could understand, and he started playing tabla very well, but that guru also could understand. And he threw all the ashrafis on that prostitute or a female. And after that, son of Raja, of king, prince also gave his diamond ring and threw it at her. The daughter, who was not getting married for so many years, she also gave a necklace of diamond in front of her. And after that, that singer started again going towards the king. And when she was going towards the king, Bahu Biti Thodi Rahi, Pal Pal Gai Bihai, he said, no, stop it now. You are not going to tell me this. You are just a simple tabaif or a singer, and you have earned so much in one night. He has given you all the ashrafis. My son has given the diamond ring. My daughter has given a necklace of diamonds to you. Please do not come to me. It is not done. You should not have done it. Guru says, don't stop Raja. Don't stop her, because she is my guru. How? Because I have been spending my life learning, teaching, unlearning throughout, but today, I don't know, I felt that I was not doing the justice to my sainthood, and that is the reason, as soon as she had this, ek ghadi ke karne mat kalank lag jaye, that is the reason that I threw her, or gave her all the money, that I am at guilty and I will never do it, I am going. And what about the prince? Prince says, why did I give the diamond ring to her? Because honestly, you were adamant to remain the king of this area. You are not giving up. So I had plans that today you will be killed. My father will be killed and I will become the king of this place. But after listening to this sentence, ek घड़ी के कारणे मत कलंक लग जाए. I have changed my mind, and that is the reason that I gave this ring to. And why did you give? Daughter was asked, why did you give the necklace? She says, I was not getting married. I was getting frustrated for so many years, but I was running away with my Mahavat, the elephant driver. So I was running away today itself with my Mahavat, but as soon as I heard this couplet and I thought that ek ghadi ke karne kahin kalank na lag jaye, that is the reason that I have given my necklace. And can you imagine what was the response of that girl? She says that if one sentence, a split second becomes eternal, if one sentence can change the lives of Guruji, daughter, prince, and you, Raja, I have also changed my life. From now onwards, I am not going to sing, I am not going to perform, and I will lead a holy life afterwards. And I will not have any cascade of events. And that is my message to our younger colleagues is, please, power of now, power of one has to be appreciated, and never ever think that you are learned. The day you become learned, you are doomed. Please remain a learner, unlearn, learn, and relearn, and then only, and never ever think that I am Dr. Parveen Bhatia. Please take out I out of this and remain humble, have the humility, one poof, and you are gone. So why should have ego stand in between us? We have ultimately been able to serve the people, the poor, the VIPs, everyone. So we should carry on in the same wavelength and help the people as much as possible before saying goodbye. Thank you very much. Thanks a lot. God bless you all. Yes, I knew that is the reason that I stopped. Few words about the book. I think I will write a book for describing a book. What I mean to say, why did I go in one go, read from cover to cover, and then again I started, and again Indu said that why are you taking so much of time to read one book? He has given you one book and you are taking so much time. I said that you should immerse yourself. This man has given his thoughts, just not the words. These have been his struggle. He has shared his life experiences. He has shared that how could it be that he could leave, he or somebody else had done a mistake of leaving the foreign bodies inside the abdomen, and then so much of cascade of events had followed. Even if it was not a mistake, he had to suffer. So what I mean to say is, until and unless you are immersed into book, and believe me, why I was very much interested in reading the second time, because I have also gone through the same phase of life, that I have been trained in Maulana Azad Medical College, then I started working in corporate hospitals, then I started my own hospital. When I started my own hospital, the corporate said, goodbye, you cannot operate at both places. And after a few years, when I was doing an excellent work in my hospital, then another corporate hospital, Gangaram Hospital, invited me to come and join Gangaram Hospital. I said in as many words that I was chucked out of the corporate hospital maybe 12 years back because of my hospital, and now because of my hospital I am being invited to head in Gangaram Hospital. So what I mean to say, life is a big circle, and one should always respect जो हो रहा है वो अच्छा हो रहा है और जो होगा उससे भी अच्छा होगा. So our thinking has been, and I know how much suffering, how much happiness, how much contentment, how much struggle Niba has gone through, you have gone through in making such a beautiful. I had a visit to Kaizen Hospital that day, and I was so thrilled that ICU is so beautifully managed, so many people working, so many patients were there. So I think to take out the time in such a busy practice to take out the mental stress and then go to US and not spend the time in malls for shopping, but he was spending the time in writing the book. I have hats off to you. Sanjiv, thanks to you that and believe me, whenever I used to see Amitabh Bachchan film or some good film, I always used to think that I am Amitabh Bachchan, right? So that is the part of the art. That the actor, the hero is playing such a role that he ultimately, the people in the crowd, they also start feeling that he has embodied us. Same way, when I was reading your book, I was thinking that it is me, that ultimately I am starting a hospital and I am having some challenges from the staff, from the doctors and so on and so forth. But you could always swim across so beautifully, so wonderfully, and God bless that I know that you are not going to stop here. And you should not. Go to US, again write another book, and then we will again have a mammoth gathering and make it big. You have proven it, that writing a book is one part, to project also is another part. So you have done it in a beautiful manner. I wish that Dr. Nibha, you and Pranali also, I think she should be on the line. She has sacrificed so much that you could ultimately give her so much. Thank you very much. God bless you all.
Thank you very much, Dr. Bhatia, sir. It was a really electrifying lecture. Now the book is available on the Amazon also, so you can directly purchase. Anybody, any well-wisher can purchase from that. And one small announcement that the lunch is waiting for us, but after small talks from Dr. Atul Shah, Associate Surgeon at Kaizen, I request Dr. Atul Shah to come on the stage.
Good afternoon. After hearing the profound lectures of the seniors and our teachers, I'm not going to take much of your time. Spending nearly 40 years together, I'm fortunate to be a part of the journey what Sanjiv has described in his book on Big 5 Lessons from the Life of a Surgeon. Since early days, Sanjiv has been passionate about whatever he does. Believing in sharing is caring, he has been always ready to teach juniors, undergraduates, even during that time of the study. Even after when we came to private practice, he has been a constant learner to add new skills to his arm. He has always taken lead to teach us as a team and lead us to accept the new technologies, new developments in the field of GI surgery, like minimally invasive surgery, advanced, even robotic surgery and all. During all this time, I've seen that during the whole journey, patient has remained the center of all activities for him. I vouch for the times when I've seen that never lose the hope and keep fighting spirit. It has helped so many sick patients during all this journey of 30 years. In the book, he has thrown lights not only on the hardship of medical profession, but also it presents a positive picture of the life devoted to the society for the service of the mankind. He has been very transparent, explaining about his experience about practice setup, team building, and many more practical aspects of surgical career. I think it can be a torchbearer for the upcoming surgeon who want to start their career in surgery and especially GI surgery. Lastly, as he hints us the secret of his happiness, and that is love your profession. Don't burn out. Enjoy your work. Celebrate your work. I congratulate Sanjiv for sharing all this wisdom with the group. Thank you.
Thank you very much, Dr. Atul Bhai. I now request Dr. Ankur Tiwari, who was a fellow at Kaizen Hospital, and at present he is a consultant at Adikura Hospital, Baroda.
Good afternoon, everyone. It feels privileged to be here on this podium, on this event where my mentor, my superhero, Dr. Sanjiv sir, has launched this book. For me, Sanjiv sir has been the mentor. He has been the guide. He has been like a god for me, and I mean it literally. To me, it is not just big five lessons from a surgeon's life. To me, it is big five qualities of surgeon, that is Dr. Sanjiv Haribhakti for me, and from his life what I have imbibed, what I understand, working with him closely. Five qualities that inspire me are: first quality is he is believer. He believes in you. When he says he believes in you, he literally means it. My first meeting with him was when I was giving an interview for the fellowship. I was doing my residency in Mumbai, and it was not the very right time to give that interview. But to consider me eligible for that interview and at least interviewing me was a big thing for me. At that time he asked me, why are you interested and why are you so early coming for this interview? I said, sir, I had been following you for 2 years and I don't want anyone else to come for the interview before I come. So sir laughed at me and said, first you should concentrate on your exams and then you should be considering to join the institute. I said, sir, I respect that, but I will make it a point that I work hard, I give my exams, and I'm here to express that I, without wasting any time, want to come to you, want to join your team, want to work with you, and similar applications must have been there. He had been interviewing others also, but to believe in me at that point of time that I am literally wanting to join, nobody else I wanted to join, nowhere else I wanted to go to learn. I think believing in that is the biggest quality, and that teaches me that as a surgeon you should be a believer. Not only in that incident, but in lot of patients' care, I have seen that what he plans for the patient, he believes in it. And going through the turbulences while treatment, he still sticks to those plans and he has believed what he has planned for the treatment. So I think that is the biggest quality. Second that inspires me is his fearless nature or fearless attitude. Remembering about few patients, once I joined the institute, it was just before Diwali. On the day of Diwali night, I had called sir. I was scared that he would be, busy with the family function and all. I called him up, sir. There's a patient who's transferred from a gynec hospital, and patient is having peritonitis. Patient is in a bad shape. He said, I'm coming. You get the CT scan done. I got the CT scan done, and while viewing on the console, he asked me about the condition of the patient, and I reported it with the poor blood counts and patient on supports and all. And then he asked me, looking into my eyes, what is your plan? I said, sir, maybe as patient is in bad shape, probably I would escape doing anything from, I would not take that bold decision of operating. He said, because patient is in a poor condition, we should operate, get the theater ready. So that is the fearless attitude I have seen him, and that inspires me. He has been leader. That is the leadership quality, like sir said, is very important when you are part of the academic institute like this, when you are looked upon by junior surgeons like me, where people follow your footsteps. So being a strong leader, and I could relate to one incident. Sir was away for a conference, and just before going to the conference, we had operated a patient, and patient developed biliary peritonitis. We informed sir that sir, patient is deteriorating and maybe patient needs re-exploration. The instructions given by sir were, I am reaching as soon as possible, but don't explore the patient. And that was not understood by many of us, that why sir would give such instruction that don't explore until I reach. After reaching, he explored the patient did well, but patient's relative were very anxious. Patient counseling and outcome were very much, it was a matter of discussion. So maybe sir had the feeling beforehand that, this case should not be operated by anyone else but by me, because the hardships that are going to be faced by him would not be, nobody else would be in a position to take. So the leadership quality that sir has always shown is a big quality for me that inspires me. Besides that, sir has been a promoter. He has, whenever we have approached as a student, sir, we would like to take some exposure in particular subspecialty. He would promote us, not like other mentors who would like to say that, you are having all the exposures over here. He would always promote. He took efforts to send me to Korea for a fellowship. He has always been promoter. And one more example, personal experience that I have with sir, which tell me about the promoter quality that sir has, is when after towards my termination of the fellowship program, I didn't know where to go, and I was relating to sir. I was sitting in his chamber and I asked him, sir, I don't know where to go, what to do. I think I would want to be part of this family, and I would continue into the department in whatever way you feel I can fit. And sir said, no, you have to go. So I didn't understand that, but I accepted that because it was from my God's mouth, so I had to take it. But I didn't understood why. Then I started my journey in Baroda, and after a couple of years when I met sir could relate to that, and he told me, you were a bit reluctant to move out of the Kaizen, but today your growth is satisfying me, and that's why I wanted you to move out of the institute. You had to explore something else. And I think that quality, that visionary quality sir has, and I respect that. Besides that, what I've found is sir is very much spiritual, and that is a quality probably that drives him. To me, I am not a spiritual person, and I don't imbibe that quality. I am sorry for that. I would rather learn to understand how does that quality or that belief of spirituality drives sir. So I would request sir to say it in 2 minutes, that how being spiritual has always driven him, because I have always seen him being spiritual, being calm-minded, being positive. Again, I would like to share an incident. Sometimes, during ward rounds and ICU rounds, it is always hectic. Not all patients are doing well. So ICU was full of all patients. All counseling that sir used to do was, patients are doing well, they'll improve and all that. So at times it gets on nerves. He was supposed to operate a patient for a major surgery, which again is quite demanding. So in middle of all this, I was stressed as a fellow, having no responsibility. Even I was stressed that how sir is going to, perform this surgery. And in the changing room, I hear a whistle or a murmuring of music, la 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 la. That is how sir used to sing when he enters the OT. So I was surprised to see his attitude, that how calm he can be when he is, he has been through so much hectic schedule, and still he has been, light-minded, always positive about patient's outcome, always caring about the team. So showing all those qualities, I think that is 5 big qualities that I inspire from sir. And like I said, sir, I would like to know how being spiritual drives you through all this. Thank you.
Thank you very much, Dr. Ankur. And now we are near to conclude our program, and I would like to request Dr. K.S. Patel sir for the vote of thanks. After the program, you all are welcome for joining the lunch.
At the end of the program, Honorable Dr. Haribhakti, learned speaker from all over the India, Kaizenian and fellow delegates. As a senior member of this Kaizen family, this honors of expressing a word of thanks is given to me, and I'm feeling proud and privileged to express my sincere gratitude to all of you, those who have contributed in successful of this organization of CME book launching on 11th anniversary of this Kaizen hospital. First of all, I express my heartfelt thanks to Dr. Haribhakti, who has colleagues, my friends, who is guiding star of this hospital, who has written this beautiful, marvelous book, and has a big 5 lessons for the benefit of the who wish to succeed in this GI surgery, in this noble profession. The experience described by our leader, learned author, can prove a great guide to anyone pursuing medical profession. I wish I had the benefit of this such a beautiful book in my early period of life, so I can shape my life better, and I could have beneficial more at this stage. The book is a great inspirational work coming directly from the heart of a man who has taken up his profession with sincerity and dedication. Thank you, sir, for this great book. We are deeply grateful to all learned faculties, those who are virtually and physically present and coming from all distant part of this India, who have taken trouble to travel from great distance to participate in the CME. They too have shared their experience with us and about the book. And without them, the CME could not have been successful. I extend my sincere thanks to Dr. Nageshwar Reddy, Dr. Professor Nundy, Dr. Pallani Velu, Dr. Adarsh Chaudhary, Dr. Vinay Kapoor, and Dr. Parveen Bhatia. My special thanks to the member of the team Kaizen, who have been working sincerely for the last 3 months to make this organization CME successful. I must mention the name contribution of this Kaizen CEO Amit Banerjee, Dr. Samiran Bhatia, and IT team Sandeep, and all Kaizenian who has worked eventually for this success for this CME. I express my thanks to Bismith for conducting the CME. Last but not the least, my special thanks to all the delegates and who have joined us digitally. But for your active participation, the CME could not have been possible. Thank you for sparing your precious time from your busy schedule. Thank you for all.
Thank you very much. And now we declare this program concluded. I request everyone to have a delicious lunch is waiting for all of us, and please do not forget to collect your copy of book, which is especially gifted on this occasion by Dr. Sanjiv Haribhakti himself. Thank you.